Good morning to everyone. My name's Susan Miles and I'm the Director of Health Technology Wales. Thank you so much for taking the time to join us for our 5th anniversary event, which I'll be chairing today. We're delighted to have had over 160 participants register for our event today, representing the NHS, social care, local authorities, technology developers, academics and third sector organisations. And we're really pleased to welcome such a diverse audience and very much encourage and welcome your engagement and questions both today and after the event today. Please do get in touch. We've a really packed programme which we hope that you'll find interesting and stimulating. But first, before we get started, just a few housekeeping items to begin with. So please do note that we will be recording the meeting today and we plan to share it on our website after the event. We will be circulating all the slides that are shown today bilingually, so you'll receive them by email link afterwards. But any additional audio recording is not permitted. We do encourage you to engage with our social media channel today. So if you'd like to discuss or to make any comments, then please note the event Twitter hashtag, which is hashtag HealthTechWales is 5. So our agenda timings are tight because we wanted to pack a lot in. So I'll be doing my best to try to keep us to time and would really appreciate the speaker's assistance with that. We very much would like to encourage some active discussion and debate. So please do consider any questions that you may have for our speakers and post them in the Teams chat box. And we'll do our very best to answer them as many as we can today. And we'll follow up on any outstanding questions after today's event. So to get us started, without further ado, it's my great pleasure to introduce Professor Peter Groves. And Peter is Chair of HEW, who will offer a welcome to our event. Peter is a consultant interventional cardiologist at the University Hospital of Wales. He's also Chair of the MHRA Expert Advisory Committee and a previous Chair of the NICE Medical Technologies Advisory Committee. Peter has great interest and experience in the regulation and assessment of medical devices in the context of the UK NHS and has published extensively on these matters. Over to you, Peter, for the welcome. Thank you.
Susan, thank you so much. And let me add my very warm welcome to everybody who's joining us this morning for this important celebratory event. I'd like to set the scene with some introductory comments, if I may, and celebratory events provide the opportunity to do two things. Firstly, to reflect, to look back and reflect together on how much we've achieved, how far we'd come as an organization during the last 5 years, but also an opportunity to look ahead as well, to reflect on where we are at the moment and what the future priorities are. And it's with that in mind that I'm going to make my comments as an introductory element to this meeting. So next slide, please. And I think it always helps in that regard to go back to the beginning and just remind ourselves of the remit that was set for us by Welsh Government when Health Technology Wales was established back in 2017. Our remit came from the conclusions of the Welsh Government Access to Medical Technologies in Wales report that was published in 2014. The aspirations were to set up an all-Wales medical technology appraisal mechanism that provided a robust evaluation process and a rather more strategic approach to commissioning new medical technologies in Wales. An approach that was driven by clinical and population need, founded on evidence, ensured equity of access, and involved the engagement of stakeholders, including clinicians, patients, industry, and research partners. And importantly, a programme that offered the opportunity to promote the uptake not just of guidance coming from Health Technology Wales, but also from our partner organisation, NICE, and to include a formal audit process of adoption. So really a very testing and full remit we were presented with at the outset. Next slide, please. And in order to achieve success for HTW, we needed to have a delivery plan. And this is a plan that has matured and developed over the last 5 years or so. And before I pass comment, I want to pay recognition to my colleagues on the HTW executive group, our colleagues Steve Ham and Donna Mead from Velindre, with whom we have very close ties. Our colleagues in Welsh Government, we're delighted to have received support from David Evans, Tom James, and previously Ifan Evans in their roles as liaising with us, and have been delighted throughout to receive the support of 2 consecutive Ministers for Health and Social Services in developing our organisation. So we needed a team. We needed a multidisciplinary team to be able to deliver the work of HTW. We needed to have a vision, we needed a mission, and we needed to agree the principles by which we were going to work. It was really important that decision-making for Health Technology Wales was led by professionals. So we have 2 professional advisory committees that we established to lead the way. And to do that and to do our work, we need wide stakeholder engagement across the health and care sectors in Wales. We need representation from all 4 corners of Wales. And of course, we needed strong links with our colleagues in Welsh Government. It was important in that early remit to establish an audit of adoption of not just Health Technology Wales, but also NICE medical technology guidance. And it's important to remember that constantly we need to reevaluate ourselves and our success against important metrics associated with impact, associated with value, and the extent to which we're supporting innovation in the Welsh health and social care sectors. Next slide, please. So just a few comments about each. Well, firstly, our team. We've got a fabulous team of multidisciplinary experts. This is a team from small beginnings that is now 28 people strong. It's led very ably and has been appointed by my colleague Susan Miles, from whom you've already heard. And this is a team that has health service researchers. It's got health economists, information scientists, communicators, administrators. It really is an eclectic group of highly dedicated and professional individuals. And I want to take this opportunity to applaud the work that they've done over the last 5 years, which has got us to where we are now. Next slide, please. Our vision is to develop a world-class HTA organization that facilitates the identification, the appraisal, and the adoption of health technologies that offer the most promise to deliver improved health outcomes and value for the people of Wales. Our mission is to drive improvements in population health and care services by applying the very best available evidence to inform decisions on the appropriate use of health technologies in Wales. Next slide, please. The work of HTW is founded on some really important principles. And the first principle is that everything we do is founded on evidence. Evidence not just from the published literature, but also evidence that comes to us from the experience of clinical experts, care experts, from patients, from members of the public that we represent. Everything we do is transparent. Our professional advisory committee meetings are held in public. All of the documents that support our decision-making are published on our HTW website. We're collaborative in everything that we do. We collaborate with experts, public and patients, members of industry, and with government. And yet, all of our outputs are independent of all of these. And the strategic and the operational work of HTW is informed by stakeholders from across the wider health and social care environment. And you'll hear more about this later on from Sarah McCarthy, who chairs our stakeholders forum. Next slide, please. We have 2 professional advisory committees, the assessment group, which is responsible for the selection of topics for our appraisal, and then the overseeing of scientific scrutiny of the evidence that is then presented to the appraisal panel, which is the decision-making group that prepares our national guidance. And this slide just gives an illustration of the multidisciplinary representation on the appraisal panel. So in addition to myself as chair, a clinical cardiologist, I'm joined by a number of senior clinicians representing the clinical networks. We have NHS Wales management and strategic planning representation at a high level, medical director, directors of planning, therapies, healthcare scientists, nursing. We have procurement, we have specialist services commissioning with seats at the table. Importantly, we've got strong representation from Social Care Wales and from partner organisations, Life Sciences Hub Wales, academic centres, members of the public and patients, and of course industry as well. Next slide, please. And just a quick overview of the work of the assessment group and the appraisal panel over the last 5 years. So we've considered during this period of time 389 topics that have been notified to us, mostly from industry, mostly from the healthcare sector as well, but also from government, from the third sector, from academia too. And if you look to the right-hand part of this slide, you'll see that approximately 50% of topics referred to us are not suitable for our programme, but we have a signposting group. We make sure that those are then referred on to other partners more appropriately within the system. But approximately 50% result in the publication of high-level summaries of topics, which are topic exploration reports. And we've published 51 more detailed evidence appraisal reports, and those have informed decision-making that has led to the publication now of 33 pieces of national medical technology guidance. Next slide, please. And our team at HTW estimate that if all of that guidance were now implemented by the system or over the last 5 years and onwards, then we estimate that more than 365,000 people per year in Wales would benefit from that guidance. Next slide, please. I've talked about collaboration. I just want to illustrate that in the next 3 slides. Patients and members of the public, they're central to everything that we do. And I want to congratulate Alice Evans and her colleagues who've developed a really mature and well-regarded patient and public involvement program at HTW. We've had input from the PPI program extensively in our decision-making, and that is tailored to the specific need of the technology being appraised. So for example, we've had 15 patient submissions, we've had 10 questionnaire surveys circulated, we've had patient evidence literature reviews, we've had involvement with patient organizations. But the important principle is that this work enriches the output of Health Technology Wales. It ensures that our outputs are relevant, that they truly do represent the experiences of people and patients who live with conditions and live with circumstances that we're trying to improve through our guidance. And the next slide, please. We've also built up very important and strong links with industry. And I would like to again pay recognition to the work of our industry users group. Llewellyn Trickett, thank you for your leadership, and thank you for the liaison that you provide between industry and HTW. And this is so essential to the success of our appraisals. We could not do our appraisals without the collaboration and cooperation of colleagues in the life sciences industry. We've developed our own scientific advice service. We're eager to work with innovators, developers, to help them understand the evidence they need to accumulate and gather to support their innovations. We've got very important strategic partnerships, which we value: the Life Sciences Hub, the Specialist Commissioners, NICE, the AWTTC on the drug side of things. And we've collaborated with NICE, with MHRA, with our colleagues in Scotland to be part of the Innovative Devices Access Pathway, which offers so much in the future. And we collaborate with NHS England as a partner in the new innovation service there. Next slide, please. But our job doesn't stop with just publishing guidance. It's really important that we then promote the adoption and the implementation of our guidance and guidance coming out of NICE. We're very grateful for the professional oversight and the leadership offered by the All Wales Medical Director Group. And this has allowed us to build very strong connections with each of the 7 local health boards. And we've established agreed methodology on which to base an audit of the adoption of our guidance and NICE guidance. And this has led for the first time this year to completion of a pilot of the auditing of adoption and the submission to Welsh Government of our first audit report. We believe this to be groundbreaking work in the world of health technology assessment, and you'll hear a lot more about the detail of this later in the meeting. Next slide, please. But we're an organization constantly looking to the future as well as to the past. And we have a strategic plan that we've published that takes us all the way to 2025, which sets out the immediate, the medium term, and also our long-term strategic aims. And this was developed in wide collaboration and conjunction with partners within the system, and we're delighted that it was received well and received the support of the Minister for Health and Social Services last year. This is a living document. It's one that we revisit, we update each year when we're planning our strategic intentions for that given year. And it's a plan to which we're constantly responding, and we listen. We're an organization that is agile. We want to respond to the needs, the current needs of those whom we serve. Next slide, please. So we've achieved a lot in the last 5 years, a quick overview of that. But we're now really constantly having to reevaluate the question of demonstrating how we can show that HTW continues to have growing impact, how as an organization we offer value to the system, and demonstrate how we're supporting innovation within the Welsh health and social care system. And it was with that in mind that we have planned today's meeting. This will provide us with an opportunity to focus in turn on each of these, explore them with you in more detail. And Once again, welcome. We hope you enjoy the meeting today. We hope you find it interesting and stimulating. And let me hand back now to the able hands of Susan to guide us through the agenda. Susan, thank you very much.
Thanks, Peter, for that welcome and for setting the scene for our programme so well today. So next, we're delighted to share a short pre-recorded video message from Eluned Morgan, Minister for Health and Social Services at Welsh Government. Eluned Morgan's political career started when, aged 27, she was elected the youngest member of the European Parliament. In May 2021, she became the Minister for Health and Social Services and has responsibility for all aspects of health and social care in Wales. So Katie, I'd be grateful if you could now run the video. Thank you.
Helo bawb, fi yw Eluned Morgan, gweinidog dros iechyd a gwasanaethau cymdeithasol yn Llywodraeth Cymru. I'm Eluned Morgan, Minister for Health and Social Services in the Welsh Government. Croeso cynnes iawn i'r achlysur arbennig hwn I ddathlu 5 mlynedd o dechnoleg iechyd Cymru. A very warm welcome to the Health Technology Wales 5th anniversary event. Health Technology Wales was established by the Welsh Government in 2017 to support a national approach to the identification, appraisal, and the adoption of non-medicine health technologies. And we know that technology has the potential to play a hugely vital role in improving the quality and the efficiency of health and social care delivery. Our aim in setting up Health Technology Wales was to address some of the challenges and barriers to the adoption of potentially life-enhancing and life-saving technologies. One of the biggest challenges hampering technology adoption in the past has been uncertainty about which technologies offer the best benefits for people and the best value for the service. Health Technology Wales has established a well-recognised infrastructure to address this challenge during the last 5 years by establishing a high quality and transparent all Wales evidence-based appraisal process for medical technologies. Today, on the 5th anniversary of Health Technology Wales, I'm pleased to look back on what it has achieved for the people of Wales, but also to reflect on what the future holds for the organisation. So let's begin with the impact Health Technology Wales has had. Since it was set up 5 years ago, HTW has published more than 30 pieces of national guidance on non-medicine health and care technologies. Now, each of these technologies has the potential to significantly impact the individual as well as population health and social care in Wales. During the COVID-19 pandemic, HTW became a collaborating partner of the COVID-19 Evidence Centre and played a vital role in supporting evidence-based decision-making in the Welsh Government response to the pandemic. In fact, we know that so far, the national guidance published by HTW has the potential to impact the lives of an estimated 365,500 people in Wales. It helps to illustrate this with some specific national guidance examples. So last year, HTW recommended the use of flash glucose monitoring to improve the monitoring of blood glucose in people living with diabetes. They found that this device, worn on the patient's arm, has the potential to reduce the complications of diabetes and make day-to-day living easier for patients on insulin. This year, HTW published guidelines recommending the adoption of electronic blood management systems to help prevent errors in the blood transfusion process. This is another example of how state-of-the-art digital technology can improve patient safety. Recently, Health Technology Wales published its first piece of social care guidance, recommending the use in Wales of a structured psychological support programme called START to support carers of people living with dementia in the community. The working partnership established with Social Care Wales as a result will help ensure that technology opportunities are explored and implemented when providing solutions to social care challenges. Earlier this year, HealthTechnology Wales published its first audit report of the adoption of HTW guidance by NHS Wales organisations. Now, this pilot looked at the impact of 8 pieces of HTW guidance across Welsh health boards. It showed that in most cases, national guidance published by HTW is having a positive impact on patient care, and that awareness of the guidance is now high. As expected, there are also some real barriers to adoption. So it's worth you noting that Judith Paget, as Chief Executive Officer of NHS Wales, has written to her CEO colleagues to note the barriers to adoption highlighted in the report and to reflect on how NHS Wales organisations can work with HTW to overcome these barriers, both within organisations and across professional and national networks. Looking ahead, both health and social care sectors in Wales face complex and unprecedented challenges, particularly as we emerge from the COVID-19 pandemic. HTW continues to work closely with national and international health technology assessment agencies and has established successful collaborations with a wide range of partner organisations, both at home and abroad. There are a number of opportunities ahead of us to identify and implement innovative health and care technologies in Wales, including the development of an innovative devices access pathway with other UK government partners. The overriding imperative, however, is the importance of making the correct decisions when searching for the best quality and value for the people of Wales. I'm confident that HealthTechnology Wales will continue to play a pivotal role in ensuring this happens. Hoffwn I ddiolch I bawb sydd wedi cyfrannu at waith technoleg iechyd Cymru dros y 5 mlynedd diwetha, a dwi'n edrych mlaen at lwyddiant pellach yn y blynyddoedd I ddod. I really want to thank everyone who has contributed to the work of HealthTechnology Wales over the past 5 years, and I look forward to their continuing success, to your continuing success in the years to come. Mwynhewch y dydd. Please enjoy today's event. Diolch yn fawr iawn I chi.
Okay, thank you, Katie. Just to say, there was some slight static, I think, in the presentation. However, that will be included in the slides that you'll receive after today's event. So if you'd like to listen again at your leisure, then that will be easy to do so. As well as funding HTW, Welsh Government has given us fantastic support in the last 5 years as we've developed and expanded the HTW and its contributions. We extend our thanks to the Minister for her kind words and also to Welsh Government colleagues who have enormously helped us and for their contributions in the last 5-year period. So getting on to our main programme now, 5 years into HTW's development and operation, and in preparing for today's events, we've been asking ourselves the kind of fundamental so what questions. What difference has HTW made? So in the brief time that we have together today, we'd like to reflect on and celebrate the varied contributions of HTW's work that we've made over the past 5 years. And specifically, we'd like to focus on the impact of our work, the value it adds, and how it supports innovation across Wales. So we want to start by sharing some examples of the impact that HTW's work has had to date. And first up, we have Dr. Julia Platts, who's a consultant diabetologist in Cardiff and Vale University Health Board. And Julia's going to offer us a clinical perspective, reflecting on the impact of HTW's national guidance on the Freestyle Libre flash glucose monitoring device. Julia was appointed as the National Clinical Lead for Diabetes in Wales in 2014 and will help to has been leading on the delivery of the Diabetes Delivery Plan. Please do post any questions that occur to you during the talk for Julia. And with that, we'll hand over to Julia. Thank you, Julia, for joining us.
Thank you, Susan. Thank you for that kind introduction. As Susan said, I'm here to talk about the impact of Freestyle Libre today and the impact of the HTW guidelines. So I'm going to start by going back to the bad old days. This is what used to happen. People with diabetes have to keep their glucose levels in a sort of reasonable range to feel well and to avoid the complications of diabetes, such as blindness, kidney disease, and amputations. And to do this is quite difficult, and multiple decisions have to be taken every single day. And these have to be guided by the blood glucose levels. And to do that, people had to stab their fingers with a sharp needle. So imagine every time you eat or you exercise or you go to sleep or you do anything, that's associated with the pain of stabbing your finger and the considerable inconvenience. So it's unsurprising that a lot of people would skip on the testing altogether. Next slide, please. Freestyle Libre is a little disc that's worn on your arm that measures the glucose in the interstitial space, and it's replaced every 2 weeks. And to measure the glucose, people either swipe this like a barcode with either a little reader or their smartphone, and they get an instant glucose measurement, and they can see what's happening to their glucoses all the time when they exercise or when they eat. And you can also see the previous 8 hours as well. So you can also tell what's happening when you're asleep. And nighttime and sleep is a major time of worry for people with diabetes, that they may be going low and have hypoglycemia. And people can also share their data remotely by something called LibreView with others such as healthcare professionals. Next slide, please. So when these sensors were introduced, they were quite expensive, £45 each. So when they were first introduced, it was thought that they can only be given to people if it's a cost equivalent intervention to testing. So people had to be testing 8 times a day or more, or should have been testing 8 times a day or more to have Freestyle Libre. And what we actually saw in clinical practice was that people who were doing practically no testing or very little testing had the greatest benefit from this intervention. And oh my goodness, did people prefer it to stabbing their finger. So we approached HealthTechnology Wales to reassess the guidance. Next slide, please. So this is where we get into the evidence that Peter was talking about, the real world versus the RCTs. And what you often find with diabetes technology is that the RCTs only show a very minimal benefit to an intervention, because often the control group is a group who's doing everything completely properly, testing their glucose and have very tight glucose control, and often don't represent the majority of people with diabetes. And the Association of British Clinical Diabetologists collected real-world data, observational data, which found that the HbA1c fell when people used Freestyle Libre, and the higher your starting HbA1c, the greater it fell. And this is really important because the HbA1c is the measurement that correlates to those complications such as retinopathy and kidney disease. We saw that hypoglycemia fell, and hypoglycemia is one of the most feared complications for people who are treated with insulin. And for a lot of people, it's a major barrier to improving glucose levels, either getting hypoglycemia or fear of hypoglycemia. We also saw that hospital admissions fell when using Freestyle Libre, paramedic call-outs fell, and diabetes distress scores fell. So this was all really important data. Next slide, please. We also found that this was a highly valued intervention, and I've been working for about 33 years now, and it's one of the most highly valued interventions that I've seen by people living with diabetes. People really didn't want the pain and inconvenience of blood testing, and they really wanted to be liberated from that continual worry about whether their blood sugars were going low, for example, during examination or during exercise or during a lecture, for example. And now they can just see their glucoses whenever they want to. So it may have quite a big impact on the mental stress of diabetes. And we did at the time have an important conversation about value-based medicine from a patient perspective. Next slide, please. So HealthTechnology Wales recommended a very favourable recommendation from our perspective. the evidence supported that the routine adoption of flash glucose monitoring for people with diabetes treated with insulin. They suggested this was a cost-effective intervention, and other people may benefit from flash glucose monitoring, such as those people who've got a needle phobia, or those people who may not understand why their glucose is being tested, why they're being caused this pain. So people perhaps with dementia or learning disabilities, those who need additional help to monitor their glucose, such as the elderly, and perhaps those who need intensive monitoring for a short period of time, such as people with gestational diabetes, diabetes in pregnancy. Next slide, please. So as a consequence of the HTW recommendations, we've got a lot more people who've got a better quality of life. They're living with less pain, less distress, and this has a very important potential of fewer complications for people living with diabetes. And these flash glucose monitors have low alarms and high alarms, but this means that people can get on with their lives without that constant fear of hypoglycemia. So they can sleep at night, they can give a lecture, they can present in court without that constant fear of hypos. It means people who don't understand why their blood sugars are being tested, such as perhaps people with dementia, can be spared that pain and distress of having their fingers stuck with a needle. And people, for example, with gestational diabetes can get improved glucose control, which will improve their pregnancy outcomes. Next slide, please. The implementation has not always been a smooth path. Initially, all the Freestyle Libre was initiated in secondary care, and now it's being initiated a lot more in primary care. And of course, this does come with concerns that there's going to be an additional workload. And we're working through that at the moment, because most people with diabetes will start on this technology on their own using online resources or face-to-face via education sessions provided by the company. And really, it's not a lot of work for healthcare professionals. When the glucose is scanned, it can be scanned either by a smartphone or a reader. And earlier this year, there was a national lack of readers. And this did cause some inequality for a while, because those people who didn't have a smartphone couldn't have access to the technology. And that was particularly some of the elderly, although that's been resolved now. And we've got a new benefit coming on board. We now have smart pens. These are insulin pens that talk to Freestyle Libre and can give people a lot of additional information and a lot of benefit managing their diabetes. So diabetes technology is really moving at a pace at the moment, and it's really fabulous to have health technology supporting that and enabling people with diabetes to live better lives. Next slide, please. I just want to say thank you and hand back to Susan.
Thank you, Julia. It's really fantastic to get your clinical perspective, and from the point of view of HW's work. I mean, we're here to work for the service and to promote evidence-based care. So to hear these examples of where the guidance has really impacted on patient care is really rewarding for us. So thank you so much. We've not had any questions come in on the chat. Oh no, there's one. Let me post this one to you, and then we'll move on. So what did you see, Julia, as the key benefits to a clinician like yourself submitting a topic to HEW for appraisal?
Oh, it had enormous impact for us because people simply couldn't access these technologies. You know, it was only a smaller subset of people with type 1 diabetes who could access this technology. People with type 2 diabetes couldn't access it at all. So it's had an enormous impact for people living with diabetes. And as a clinician, it's really great to be able to offer people something that you know is going to benefit them, something that you know is going to A, make their life easier, and B, improve their outcomes. So, you know, we've been absolutely delighted by it, really. So I would have said big benefits.
Fantastic. Thank you so much, Julia. We're going to move on now, and next we're pleased to share a very brief video from a patient, Elise Quarrington, who uses the Freestyle Libre flash glucose device, and she's just going to talk for a couple of minutes about the impact that it's had on her life and her care. Thank you, Katie. Grateful if you can play the video.
So I scan multiple times a day. I'm known as a bit of a serial scanner. So personally, for me, the best function of the Freestyle Libre 2 system is the alarms that they've added. So I set a level when I want it to alert me, and that kind of stops me from going too high or too low. Whereas with finger pricking that I used to do, you just get a number. You don't get any sort of indication whether you're going high or low. So now with the alarm, I set mine at 4.5, so it gives me a bit of leeway before I go into a hypo, so I can act on it quicker. Everybody struggles with finger pricking a bit because you just don't get that much information. It's invasive, you know, it hurts. You know, it's really suited my on-the-go lifestyle, just being able to grab my sensor, quickly scan. It's a lot quicker than finger pricking used to be. You know, it's not solved my diabetes, nothing will ever take it away, but it's definitely made the everyday of living with diabetes a lot easier.
So sincere thanks to Elise for sharing her experience with us today. Patient and public involvement is at the heart of everything that we do in HTW, and we're very much indebted to our PPI partners for their thoughtful engagement and their critical input to develop our PPI processes, and these are in fact now earning international acclaim. So we're going to move on now, and next we're going to share a little bit about HTW's work to support the COVID-19 pandemic response efforts. When the pandemic hit, HTW immediately pivoted its analytical resource to support those response efforts. We were quick out the blocks and published one of the first reviews on testing, which has become a highly cited publication both nationally and internationally. In addition, we led and collaborated on 3 pan-European reviews on technologies relating to COVID-19. And then quite quickly thereafter, we became a collaborating partner in the Wales COVID-19 Evidence Centre. This has been instrumental in informing Welsh Government and Care Service pandemic decision making. And to learn a little bit more on this, we're going to hear a short video, a pre-recorded message from Professor Adrian Edwards. Adrian is Professor of Primary Care at Cardiff University and the Director of the Wales COVID-19 Evidence Centre. If you could play the video, Katie, thank you.
Good morning, everyone. My name is Adrian Edwards. I'm Director of the Wales COVID-19 Evidence Centre, and it's a real pleasure to be sharing a short recorded presentation with you today. I do apologise for not being able to be with you today for the celebration because I'm actually in clinical practice today. But to say, I really wanted to contribute and to share this short presentation with Tom about the collaboration between the Wales COVID-19 Evidence Centre and HealthTechnology Wales. So this started about 2 years ago now, as the COVID Evidence Centre was established. And at that time, we immediately reached out to a number of partner groups around Wales who were already established in their review activities, as our primary role was for evidence synthesis to inform policy and practice during the pandemic. So very quickly onto the scene came HealthTechnology Wales, and recognising their expertise in technology assessment and also the established methods that they already had. And that was really very useful to us, getting going quickly 2 years ago and being able to build on and adapt those review processes to some of our requirements. So essentially it's a vote of thanks to the HealthTechnology Wales team. We were able to stand on your shoulders and benefit from all the work and the expertise that you had in hand already. So that was enormously helpful to us. And then it's also been a great pleasure working with you all over these last couple of years in the various reviews that we've done. It's been really helpful to benefit from processes, as I say, but also people, not least Tom and David in the team and with Susan's leadership, but also did want to mention specifically for Jenny Washington and Elise Hassler with the information scientist expertise and capacity. And that's been really useful in the work that we've done, the reviews directly with Health Technology Wales, and also informing the work across the centre. So tapping into that expertise also has been really helpful. So what Tom has asked me to speak about is a little bit about the early work, and then Tom is going to speak about the current work, and I will make a few remarks about the future as well. So in terms of the early work, I'm just going to give some examples of the work that we did and how really important they were to the policy making and decisions about practice that Welsh Government and NHS Wales were needing to make in those early stages of the pandemic. So one review that was undertaken was about the transmission risks for the virus in semi-outdoor spaces. So large-scale marquees, but also the sort of awnings and semi-permanent structures that we've become quite familiar with in pubs and restaurants. And the issue was, how safe are those spaces in relation to indoor spaces and outdoors for risk of transmission? So the HTW team undertook that review and was able to provide the advice, which was about low risks of transmission in those settings, and then that fed directly into policy and the guidance that the technical advisory cell and group made to ministers to inform government policy going forward in 2021. So that was really useful. Another one, again, of high priority and profile was around face coverings. Again, in mid-2021, there were discussions about what is the evidence base for face coverings? Should they remain part of the advice for non-pharmaceutical interventions during the latest waves of the pandemic? So HTW had already undertaken a review the year before and were able to update that in the work with the COVID Evidence Centre. We did that work together along with stakeholders and identified that yes, there is some evidence for the benefits of face coverings, although usually the evidence examines it as part of a bundle of measures along with social distance, spacing, hand washing, and so on. But nevertheless, there was evidence of benefit, and therefore the technical advisory cell again was able to build that into their advice to ministers, and it remained part of advice in Wales through 2021, as we all know, perhaps in some contrast to the advice and regulations that were in place in England. So it made a difference to what we were doing in the pandemic, and overall, the changes that Wales made to manage the pandemic have been well evaluated. So fits into the big picture of a really important work. And one other one to mention from early on, there was a lot of interest in the use of pulse oximeters in primary care, my own domain, and whether giving pulse oximeters to patients to monitor their oxygen saturations would help in assessing, in reassuring, but also early detection of deterioration. And so we were asked to undertake a review about that evidence for pulse oximeters being used by people in primary care. And essentially there was very little evidence at that time. So that's an example where actually the technology did not progress as widely and as was perhaps originally anticipated. It put the brakes on it and called for further research to be undertaken from that time. So there was just some examples of the work that was undertaken early on with great colleagues at Health Technology Wales. So Tom's going to make some comments in a short while about the current work, but just to say we're now looking forward. The COVID Evidence Centre will become the Health and Care Research Wales Evidence Centre from 2023 onwards, still working with our collaborating partners, including Health Technology Wales. The brief will be more focused on health and social care, but clearly around issues wider than just the pandemic. So very much more of the same, but important work to inform policy and practice. We look forward to that continuing work from 2023 onwards for a number of years. So thank you for the work together. Thank you for offering the opportunity to share some of these remarks this morning. And I look forward now to what Tom has got to say about the current work with the COVID Evidence Centre. Thank you. Diolch yn fawr.
Thank you, Adrian, for your kind words. And if I could just also echo that from the HEW team's point of view, it's been such a pleasure to work with the collaborating partners, the 6 partners in the COVID-19 Evidence Centre, and a huge privilege to be able to contribute our skills in a small way to support pandemic efforts. Building on Adrian's reflections, we'll now have a short presentation from Dr. Tom Winfield, and Tom is one of our senior health economists here at HTW, and he's going to share some specific examples of our C19 work more recently. Tom's a member of the HEW team and he leads on economic evaluations here at HEW. So over to you, Tom. Thanks.
Thank you very much, Susan. As Susan has said, yes, I will give a little overview of the more recent topics that we've undertaken at the Wales COVID-19 Evidence Centre. Next slide, please. So continuing the topic focus adopted by Adrian, I'll offer an overview of the more recent reviews. This research took place following that initial ultra-rapid policy focus period in a time of a more standard rapid review approach. The maturing evidence base offered an opportunity to answer increasingly detailed questions. The first of which was looking at the transmissibility from the vaccinated population. This topic moved past that initial vaccine effectiveness question to look at a broader impact of vaccines. We looked at identifying the relative risk of transmission from individuals who had been vaccinated compared to those who were unvaccinated. The research identified a real disparity between and across the variants, so we have Alpha, Delta and Omicron, and we saw a decline in the protection offered by the vaccine. The evidence maturity was an important factor here. We identified that actually the earlier variants had more established evidence relative to the more recently emergent variants. So with this in mind, we were aware that it'd be very important to have continued monitoring of the literature. Interestingly, for this topic, we identified a very similar review having been undertaken by the UK Health Securities Agency. Therefore, we looked to collaborate with them in an attempt to avoid repetition of efforts. We were able to work together with the UK HSA to produce an updated paper which included important additional information. So that living review was a real success in collaboration. Next slide, please. So the next topic I'm going to offer a little insight into is the non-pharmaceutical interventions topic. So non-pharmaceutical interventions, for example, face masks, physical distancing, isolation and limits to social gatherings. We undertook a rapid review identifying the evidence on the effectiveness of non-pharmaceutical interventions with an aim to building these into a Welsh Government toolkit of NPIs. So the toolkit was aimed to improve the readiness of the government for future waves of COVID and subsequent infectious diseases or pandemics. So the evidence here consists of really in-depth modelling reviews, and the novel aspect from our point of view was that these reviews were so detailed that assessing the risk of bias and saying which should be included and which review was of value was quite difficult. That's not to say that the complexity was unrequired. The complexity reflected the statistical issues with isolating that individual impact for each MPI. We know that MPIs were often delivered in a conjunction always at the same time, so identifying that individual impact was very difficult. I'm happy to say that we were able to feed in 6 papers to the toolkit, and it's really well received by the Welsh Government. Next slide, please. The last topic I'll discuss is looking at financial support for isolation. This review looked at improving the understanding of the impact of financial support and improving compliance with isolation. So financial support for isolation was deployed globally as a tool to interrupt transmission through isolating positive contacts from the broader population. However, there's very little known about the actual effectiveness and impact of that financial support. The broad conclusion from the review was that financial support was associated with higher compliance with isolation. However, the quality evidence was poor and there was a real lack of UK-based research. Here we engaged with an evidence base that was remarkably varied and came from a huge range of disciplines. for this topic, it was as important to know that there's very little there about the effectiveness as it is to actually have had a firm conclusion. So really useful to know that there's not a lot of guidance out there. The three topics I've briefly described characterise the good work that HTW has contributed to the Wales COVID-19 Evidence Centre. I think that they characterise the dynamic, collaborative and responsive approach we've been able to offer, and I myself have really enjoyed working with the group. Next slide, please. So going forward, as Adrian has mentioned, we continue as a collaboration. In general, the success of the COVID Evidence Centre has highlighted the value offered to stakeholders and the real appetite for evidence-based decision-making. We have a range of impact from that earlier direct policy implications to general improving of understanding, and then to those topics which look to improve the readiness for future challenges. I'm happy to echo what Adrian has mentioned in terms of the collaboration continues between HTW, collaborative partners and the core team in the form of the Wales Evidence Centre, which is going to focus on health and care more broadly. So thank you very much for listening, and any questions? Over to you, Susan.
Thank you, Tom. Thanks so much. I don't see, oh, there's one question in the chat. How do the different collaborating partners in the Evidence Centre work in partnership to ensure that they share knowledge and methodological processes?
Good question. So yes, it would seem like quite a daunting task to corral multiple collaborating partners to a single aim. However, I think the core team has done an excellent job at this. We had initially weekly methods meetings that we would focus on the development within the general methods. That went to fortnightly, and we're just discussing the processes, challenges, a real open forum to make sure we have that connectivity, that discussion, and that narrative to support that. And in terms of reflecting the work that was done in the methods group, we have really detailed templates to ensure that the collaborative partners are all offering comparable research and supporting each other, really, because whilst we're all researchers, there's a real range of skill sets that we can rely upon. So it's been a really informative and interesting process. Thank you.
Thanks so much, Tom. So now we're going to move on to the final brief presentation in the impact section of our agenda. And we're going to hear a little bit about HEW's approach to measuring the impact of our work from Dr. Lauren Elston, who's one of our senior health services researchers and has led this work alongside Sophie Hughes, one of our senior health economists. So Lauren has a PhD in cancer immunology and joined the HEW team from the All Wales Therapeutic and Toxicology Centre. So over to you, Lauren. Thank you.
Thanks, Susan. So I'm going to give a brief overview of the approach that HEW has taken to evaluating impact. Next slide, please. So first off, I just want to touch on why we should measure impact in the first place. As you've heard, we have a very ambitious strategic plan and there's lots of objectives that sit under that. It's important to know that we are doing those things and those tasks, but we also want to be able to see the impact that those objectives and those activities have, and whether or not they do actually work to improve the health and well-being of people of Wales. So then you can use that then to feed future planning, as well as showing the activities which have made the most difference. In an ideal world, you'd obviously like to directly measure, for example, how many extra years of life people have gained as a result of a piece of guidance. But in reality, that's not so straightforward to show, and the health and social care systems are complex. So it's not easy to directly attribute work within the system to one particular activity or piece of guidance. Next slide, please. So how can we measure impact in a complex system? Like I just said, you can't really directly attribute what you do to change in outcome, solely what you do anyway, because the system is so broad and complex. So building on that, you focus instead on contribution and contribution analysis. So what you do within a complex system and how you contribute to the outcome that is intended or not. Next slide, please. So we've been working over the years with an organisation called Matter of Focus and using their evaluation framework, which is based on this contribution analysis. So as you can see, it starts with the what we do, the activity. So we can say that we've actually achieved what we intended and done those things. But then who with? Have we engaged with the right people? What kind of changes in awareness or reactions have we achieved? And was it what was intended or what was not? And then has that fed into them changing their behaviour? So what are people doing differently? And then the wider what difference this makes, which for us is obviously the improved health and wellbeing of the people of Wales. Next slide, please. So building on that, what evidence can we use to inform that kind of framework? And these are just examples of different types of quantitative and qualitative data. I've divided them into 3 areas, but that is just a subjective kind of division. But you can see that you can generate or use data that's automatically generated throughout our processes anyway. So monitoring our topics and our appraisal through the work programme and our project management tools, the expert consultation forms that come in from our reports and the feedback that comes from that. Importantly, our adoption audit, which you'll hear more from later. And we also have things like surveys. So the impact survey is a big one, which allows people to feedback on our work and how they feel it makes a difference across our different work areas. And that includes combination of Likert scale questions, so how much people agree with statements, and also open questions so that we can really capture what people are thinking rather than just prescribing what we think people think. And finally, comms data. So Diane is really good at measuring the social media and website metrics. And also we often get informal feedback as well. So obviously this is a wide, disparate range of different types of evidence, and it can be quite challenging to bring it all together, but the framework it gives you that structure that allows you to bring all of those pieces together and feed it into a story and an evaluation. Next slide, please. So finally, I just want to touch on how our impact is shared. We can use the framework and evaluate our activities and then show how that has made a difference through things like our annual reports and case studies that go into the annual report. So there's some examples there, and we post them on our website as well. Next slide, please. And also we've shared our work internationally as well. So we've organised and presented on international panels at something called the Health Technology Assessment International Conference. And last year we also won an award for the best impact story at the International Network for Health Technology Assessment, which is IANATA, at their Congress. So that was for the approach that we take, as well as a demonstrative example of that as well. And we now have a journal article in progress for those stories for the IANATA award as well. And there's a little quote there from Sarah, who we've worked quite closely with over the years from Matter of Focus, about how we've really worked hard to embed that impact tracking and use the framework. And next slide. So thank you very much. And if you have any further questions and want to follow up, my details are there, as is Sophie's, who leads on this with me. And thank you to Matter of Focus.
Thank you, Lauren. That was a really helpful overview. And we were indeed really honoured to receive the David Haley Impact Award last year, as it was voted on by 50 of our international peer health technology assessment bodies to acknowledge the efforts that we put into trying to demonstrate the impact of our work. As Lauren said, if you're interested to learn more, please do visit the impact section on our website, where you can find a lot of case studies, testimonies, our annual reports, our impact reports, and lots more detail should you wish it. Okay, we're going to move on now into into the value section of our agenda, and that's our focus. So specifically, what value does the work of HTW add to the health and care system in Wales? And this is ever present in our minds as we're keen to continually improve to ensure that we optimise the value that we can add from the scarce resource that's invested within HTW. So to kick us off and talking about scarce resources, I'm going to hand on to Matthew Pretty-Johns. So Matthew is our principal health economist. He's going to go through a couple of case studies, and Matthew joined us from the National Guideline Alliance, the NICE Guideline Alliance, as a senior health economist a few years ago. So over to you, Matthew. Thank you.
Thank you very much, Susan. Yeah, so as Susan said, I'm going to talk you through a couple of case studies, mechanical chest compression and video laryngoscopes, so two appraisals that we've previously undertaken at HTW. Next slide, please, Katie. So just for a bit of orientation, I'll just quickly go through the basics of our appraisal process. So we undertake evidence appraisal at HTW to evaluate whether technologies are safe, first and foremost, but also whether they're more effective than what's currently done in standard care. And another big part of that is to reduce the variation in care that we often see both within Wales and also where there's differences sometimes between ourselves and our neighbours across the border. And you know, where my primary interest lies as a health economist in assessing whether new technologies are cost effective. And that's a much misunderstood term in some ways. It's not simply about saying whether something's cheaper. The idea is NHS and wider social care budgets as well, for that matter. There's finite resources, and when you decide to spend more in one area, that necessitates a decision to spend less somewhere else. And really, that's the obsession for health economists. It's the opportunity cost. It's estimating whether the gains that you get from any new spending outweighs the losses that you'll get from whatever you've displaced by that new spending. Next slide, please, Katie. So yeah, as I said, a little bit of myth busting, just to go into the health economics a little bit. It's not about saving money and spending less. We're not interested in minimizing costs. It's all about maximizing benefits. So for a given amount of money that you spend, ensuring that you're getting the most benefits that you can from that spending. And this diagram is our cost effectiveness plane that we talk about a lot in our appraisal process. And that's so sort of changing costs on the y-axis, change in effectiveness on the x-axis. And if you think about an intervention that's coming in, it allows you to think about what impact that would have if it was adopted in care. Would it be less effective and more costly than standard practice? Would it be more effective and less costly? And those two are sort of fairly obvious from a decision-making context, what you would do in those scenarios. And then you have the kind of grey areas where something's either less effective but less costly, or more effective but more costly. And we have kind of these thresholds, these decision rules that we use to determine whether something is cost effective or not in those scenarios. And newer technologies, it's probably no surprise to say that they're often more expensive than current technologies. And so whilst they offer benefits, they're often finding themselves in that top right quadrant where they're more effective but more costly. But choosing that's a scenario that's often typical for us to see, but it's equally important to consider those technologies which do not offer value, because that frees up the money to spend on those sorts of technologies that may be more cost effective. Next slide, please, Katie. Yeah, the first case study I'm going to go through quickly is mechanical chest compression, which was the first topic that HTW appraised. Next slide, please, Kate. So this topic was proposed to us by the Welsh Ambulance Service NHS Trust. So it's mechanical chest compression devices, which, as you can sort of see from the picture, a kind of device that helps do CPR instead of needing to do that manually. It may be particularly useful when a patient is being transported, and the idea is that it could improve patients' chances of survival. That's the idea. But evidence that we found when we undertook our evidence appraisal suggested that actually they were no better than manual CPR when it was given by trained ambulance services. There was no statistically significant benefit found in the RCTs, and that was for a range of different outcomes considered within the trials around survival and quality of life, as well as more sort of system-based spontaneous circulation type measures. Next slide, please, Katie. And in terms of the economic considerations, mechanical chest compression devices obviously came at a cost, ranging from, well, around 9,000 to just under £10,000 per device. And there are also additional costs required for the consumables that go along with that device, as well as training to use the device. So in terms of thinking about the potential cost effectiveness of those devices, given that there is a lack of survival and quality of life, really in economic terms, it's not providing the value to justify those increased costs. And so it may find itself in that top left quadrant if it's slightly less effective, or maybe kind of on the y-axis of no difference in effect but more costly. So either way, the conclusion is that it's not cost effective because it's costing more and it's not really providing any additional value. And as a result of considering all of that, as well as many other factors that we consider as part of our appraisal process, the guidance was ultimately that they should not be routinely adopted. Next slide, please, Katie. So another similar study appraisal that we looked at, some video laryngoscopes for people who require airway management in pre-hospital settings. Next slide, please, Kate. So again, this one was proposed to us by the Welsh Ambulance Services Trust. So WAST again proposed this one, and it's for use in pre-hospital care. It's effectively a device to help paramedics fit a breathing tube, as you can see in that image there. And again, somewhat similar to the last one, when we looked at the evidence on this topic, we found that although it sounded like a good idea in theory and showed a bit of promise, the evidence didn't really back that up, in that the RCTs didn't show improvements in intubation success rates compared with the standard approach, which would be direct laryngoscopy. It's always a tricky word to say. However, there was evidence that findings may differ when video laryngoscopes are used for out-of-hospital cardiac arrest and major trauma. Next slide, please, Kate. So economic considerations. The cost of the video laryngoscopes varied quite a lot. They varied from around £490 to almost £4,000 for each device, and the standard ones were a lot cheaper than that. So it's quite a big cost increase, and we estimated that were they to be routinely adopted across Wales, it could lead to an estimated cost impact of around £500,000 per year. And again, similar to the last one, talking again about something that was clearly going to cost more, but didn't have any proven clinical benefits. And so again, as in the previous case study, this was an example of something that really is unlikely to be cost effective, and our guidance then reflected that again. So it suggested that the routine adoption of video laryngoscopes was not supported by the evidence. And I think that's my last slide. So thank you very much, and happy to take any questions.
Thank you so much, Matthew. I noted that in the two case studies that you presented this morning, that they focus on two technologies where the available evidence did not support adoption within Wales. And I think it's just important to note that from HEW's point of view, these non-investment signals are as important as the adoption ones. They're very important in terms of ensuring that we target the scarce resources to best effect. So I just really wanted to say that. And we had one question come in on that sort of thread saying that those two were not adoption decisions. But do you think that there's a possibility that these topics could be reappraised by HEW?
Yes, there is always a possibility of our appraisals. We have a system whereby we review our decisions every 3 years, or if someone contacts us and suggests that the evidence base has changed substantially. So that would be the trigger for it, either the timeline or that the evidence base has changed. But in either case, what we would do is review the evidence that's come in and determine whether it has changed sufficiently that the guidance does need looking at and possibly needs to be updated. And that could well be a decision to adopt something that was previously decided that we shouldn't adopt.
Thank you, that's helpful to know, and I think good for people to know as well that a negative decision isn't a no forever necessarily. Sometimes it just takes a bit of time for the evidence to catch up, and perhaps an example of that recently was on corneal cross-linking for adults with keratoconus. So HEW's initial guidance was not supported. However, the evidence base matured and it was reassessed recently in the last year or so, and that recommendation changed from a do not adopt to a routine adoption. So keep that in mind. If it's a no, there is always a possibility that we'll move with the evidence and try to make sure that our guidance is based on the best available and current evidence. Thank you, Matthew.
Thank you.
Okay, so now we're going to move on, and next up we have a brief presentation from Sally Lewis, and Sally is the National Clinical Director at the Welsh Value in Health Centre. Sally knows us very well here at HEW, as she's been on our appraisal panel committee since inception, and we've greatly appreciated her expertise and input. And she's going to reflect on how the value-based healthcare agenda in Wales aligns with the work of HEW. Sally has 24 years of experience as a GP. She established the Welsh Value in Health Centre last year, and she's also an honorary professor at Swansea School of Medicine. Thank you. Over to you, Sally.
Thanks, Susan. And as Susan has highlighted, the Value Programme and HEW have been sort of close working partners for a few years now. But in the last year, we've been really thinking about how we collaborate much more closely, because the Value in Health Centre, I suppose, is in the business of ensuring adoption and implementation of the evidence-based decisions that HealthTechnology Wales have made. So I'm just going to describe very briefly how we're thinking about doing that. Next slide, please. So, of course, value-based healthcare in Wales, we would tend to verge towards this definition from the Centre for Evidence-Based Medicine in Oxford, which is the equitable, sustainable and transparent use of the available resources to achieve better outcomes and experience for every person. So equity is very important for us in Wales, of course. And the other thing to say, I suppose, which I think Matthew was hinting at, is that cost effectiveness is not necessarily the same as affordability in our system. So we're interested in the Value in Health Centre in how we do the right things, and that means investment in high value interventions, which may or may not be technology driven, and also disinvestment. And how do we link that in with the planning process, with financial planning and the planning framework to support health boards in terms of adoption and, crucially, reducing unwarranted variation? And that's actually really difficult to do. And so Value in Health is very much aligned with global philosophy on this, which has been running for a few years because all systems are struggling. So, of course, Prudent Healthcare in Wales, we are a delivery mechanism for those principles. Similarly, in Scotland, realistic medicine. And we see slow medicine in Italy, which has been going for longer still. And the Choosing Wisely movement, of course, really has focused on de-implementation of low value interventions. But we like to sort of balance that with making sure we do investment in high value stuff as well. Next slide, please. So there are many ways to deliver value in the broadest sense across our health and care system. looking from prevention of disease through to what matters to people in their end-of-life care. And there are lots of factors on the patient side as well, of course, such as raising health literacy or supporting the shared understanding of medicine so that people are better able to self-manage and make good choices about their healthcare to meet their own goals and preferences. So specifically, the work we're interested in partnering with HTW on in the value space is around optimum positioning of drugs and devices, tailoring treatment to individuals' goals and contexts, including preferred place of care, and focusing on meeting true unmet need and reducing inequities. So we'll get into a little bit of how we're going to do that now. Next slide, please. So in truly delivering value, we have to look at that whole system transformation across a whole system of care, because value is really the sum of all of those interventions, and the sum of those is the whole is greater than the sum of the parts, really. So when we're looking at adoption of what has deemed to be a high value intervention, health boards will need to look at that in the context of their overall pathway to make sure that they are getting the best value out of that intervention, because of course the devil is in the detail of implementation, and the evidence that's generated from HealthTechnology Wales does make a number of assumptions based on where the evidence has been generated from. So when you start to do that in real life, sometimes the outcomes don't play out as we would expect, and that's not because the evaluation is wrong, it's because we have a different context, or maybe we've had a different approach to implementation. So in terms of re-evaluation or evaluation where there is perhaps a bit of a paucity of data at the beginning, generating that real-world evidence in terms of collecting outcome data is now a real possibility for us in Wales, sitting alongside that implementation of condition pathways and positioning that high-value intervention that HealthTechnology Wales have made a recommendation on. So here's just an example across a heart failure pathway, and I'll just pick out one example. So for example, in the diagnosis of heart failure, we know that NT-proBNP blood testing is a high-value intervention to screen out those who may not need echocardiography, and that releases capacity for others to access echo in a shorter time scale, thereby improving their outcomes and reducing their acute healthcare utilisation. So very high value. So how do we make sure that that is driven to its optimum across Wales, looking at the data, reducing unwarranted variation and so on, and making sure that health boards have the resources to implement that, because there are clearly implications for laboratory, for clinicians requesting tests, and so on. So in Value in Health, we're really in the business of trying to support that implementation. Next slide, please. So here's a slide about medical devices, what we might be trying to do, but actually we can apply this beyond medical devices. So of course, we're about improving outcomes, value and safety, and reducing unwarranted variation and inequalities in access to new technologies in particular. And I know you've also had a very good presentation on Freestyle Libre earlier today, which is a really, really good example of this. So some examples might be, well, we might have a novel product, which may be high value, but maybe we don't have enough data. So what HealthTechnology Wales often do in that context is offer recommendations to adopt with a caveat that more information is needed. So Value in Health, again, would be interested in coming alongside and supporting how and where we would generate that evidence, for example, through real-world outcome data collection and costing. Replacement products, of course, which might be deemed to be better value by being lower cost and similar function. That's probably a little bit more straightforward, you would think. And how do we actually stop potential overuse? Because sometimes you get scope creep with an intervention, which is high value when it's used in the correct context, but we can get suboptimal positioning in the system where it is overused, and then it is of lower value, sometimes even harmful. So we do need to track the use of interventions and make sure that they are kept within the context with which they're recommended. And the flip side of that, of course, is potential underuse and the adoption gap, which we are very, very interested in supporting the work of HealthTechnology Wales on. Next slide, please. So finally, we've been kind of wrestling over the last year or so with how specifically might we move forward to develop this work further to drive adoption of high-value technologies and other interventions. So we want to support the development of a body of real-world evidence from outcomes in partnership, of course, with Digital Health and Care Wales and the development of the National Data Resource. We want to look at de-implementation. We know that legacy products generally are very slow to be de-implemented. We kind of hang on to things. So of course we need data to understand that and understand what the barriers are to de-implementation. And also if we are doing de-implementation, disinvesting, how do we make sure that there are financial mechanisms that perhaps keep that resource within that clinical area, but redeploy it to something of higher value? And we are able to do that in Wales. It's not easy, but we do have some good case studies of where that's been done. And also, how do we support the topic calls from HTW? So how do we identify the issues that matter most? How do we reach into the service and understand where the pinch points are and where new technologies or new interventions might help? And just the other day, I was talking to Tom Crosby about the opportunities for nasal endoscopy, for example, in relieving some of those backlog pressures as we move out of the pandemic. And I know Tom's already approached HTW about that. So we will be moving forward in this vein with HealthTechnology Wales. And I think we've decided as one of our interventions to focus on an area where we've been doing a lot of work already in value in health, which is the heart failure pathway. And that will provide a template, I hope, for how we might continue to work together in the future in a very systematic way, because we already are, but to have a real system of how we use our data landscape in Wales as well. So very much drawing in the National Data Resource and thinking about how we really drive forward this adoption agenda so that the adoption audit, for example, becomes a live tool, and we're working together to get the highest value and support affordability as well across the Welsh system so that we get best outcomes and reduced inequalities across Wales. Thank you very much. Diolch yn fawr iawn.
Thank you, Sally, for a really helpful presentation and overview and for pulling out where we can best collaborate together. We've had a couple of questions in the chat. So the first one is, do you think members of the public know what value-based healthcare is and how important it is? I guess in these pressured times, we hope so, but interested to get your views on that.
Yeah, really, really interesting, isn't it? And I think if you ask the public, do you know what value-based healthcare is? They would say no. And I know this because when I talk to my family, they say, what the heck do you do? And I find it actually quite hard to explain succinctly. But when you start having conversations with the public about what it means, they actually assume we're doing it already. And then they are very supportive about the work, you know, overcoming the barriers to getting value across the system because they understand its importance. And they will actually help us very much, as you know, Susan, with those investment/disinvestment decisions. Similarly, we've just appointed a new head of person-centred care, Catherine South, within our programme. We want Catherine to work across with the patient involvement group in HealthTechnology Wales and with patient organisations so that we get a deep understanding in the public of what we're trying to do here, and that it's not all about slashing costs.
Thank you, Sally. And Richard Stubbs posted an interesting comment. So you mentioned de-implementation in your presentation. And I guess his question is basically saying, how do we expedite the more advanced, more recent, often more expensive technologies more quickly? And how do we take things out of the system that actually perhaps are of lower clinical value as new things come along?
Yeah, so this is a really difficult one. De-implementation is very difficult for all sorts of reasons. Some of those are cultural reasons from the professional side. Some of those are perceptions, perhaps from the patients and the public, that we are removing something of value for, you know, that our motives are not pure, basically. So it requires a very nuanced conversation. And the technique that I think is really helpful is the one I mentioned earlier, which is that you are taking away with one hand but giving another with another, if you see what I mean. So that you don't do you try not to do disinvestment in isolation, but you try to do it in the context of investment of something better, which might not be a like-for-like swap, but something better in the pathway. And then you're very clear, you get clinical buy-in from the clinical networks around what the aim is here, and really good engagement with patient organisations so that people understand the context and why you're trying to do that. But it takes a lot of engagement work. Otherwise, it's very easy for people to very understandably misunderstand our motives around de-implementation. So it's really hard, and engagement is, and good data obviously is the key, I think.
Thank you, Sally, and we're really looking forward to collaborating with your team on thinking about how we can approach disinvestment going forward and trying to change that narrative, as you say, about maximising benefits as opposed to Matthew indicating minimising costs. So we'll look forward to that. We do ask routinely if people have any disinvestment topics, so if there's anybody in the audience who has a burning suggestion for disinvestment, then we'd be delighted to hear from you, and please do get in touch and we'll see how we can assist. Thanks so much, Sally.
Thanks.
Okay. So we're going to move on to the next session of our agenda, and we're going to explore HCW's adoption audit function. This was a key ask of HCW included within our remit to design and undertake a routine adoption audit to monitor the uptake of not only our own guidance, but also of NICE's medtech guidance. It's a rather unusual ask for an HTA body like us, but actually I think in hindsight really helpful, as it served to focus our minds on understanding the value and the contribution that our work can actually make and where we can improve. So on that note, I'm going to hand you over to Dr. Gareth Hopkins, Senior Health Service Researcher here at HCW, who's led on our adoption audit work with Katie, and he's going to just share some of the key findings from our first pilot review, which has now been mainstreamed as an annual audit and business as usual. So Gareth has a PhD in Health Services Research from King's College London. He joined HCW in 2020 and has led on our adoption work and our social care work. And prior to this, he was a research fellow at the Institute of Health Economics in Alberta in Canada and a fellow in health policy at the LSE. So over to you, Gareth, to tell us more about the adoption audit pilot. Thanks.
Thanks very much. So next slide, please, Katie. So HCW guidance has an adopt or justify status, and that's always been the case since our establishment. And that means there's an expectation from Welsh Government that our guidance is considered and adopted, or is considered and a justification is provided if that's not appropriate. So given the range of topics that we appraise, in some cases, there may be justifications for why it's not appropriate to adopt, and that allows flexibility around that. As previous presenters have alluded to, it's really key that after our guidance is published, it's adopted, and it's important for us to audit the extent to which that's happening to ensure that we're having an impact. So in 2019, an adoption audit task and finish group was convened to assess the optimal approach to conducting an adoption audit process. And they made 9 key recommendations in a report in 2020. The key recommendations amongst those that HCW was the appropriate body to take forward an audit, and that HCW could also audit NICE guidance. And that there should be a requirement for local health boards and other commissioning bodies to support this audit and to put forward nominated contacts who could lead on this work within the system. Next slide, please, Katie. So as Susan said, there was a great opportunity here for Wales to lead on developing a process. It's not something that's typically done within HTA, and it was an area that we could use our flexibility and agility within Wales to lead on this work. We started the process by meeting with a wide range of stakeholders to assess how adoption monitoring could be developed, to try and learn from other processes and methods that have been put in place. And we then developed a process with feedback from partners that we could put forward and use to look at how our guidance was being adopted within the system. That led us to then pilot those adoption audit processes. We began that work in 2021, asking for data from the local health boards, other commissioning bodies, from procurement and from other sources. And within that pilot, we included 8 pieces of guidance aiming to cover a range of characteristics of the type of technologies that we appraise. So examples from diagnostics, medical devices, and also those that are more procedural and there isn't a specific item that needs to be procured, and also across a range of providers as well. So the health boards, WISC, and also the Welsh Ambulance Services Trust. We completed that pilot this year, and we published recently our first annual audit report, which I think is in the materials that people have been provided, and we can circulate afterwards. And as part of that pilot, we were able to reallocate some funding streams to support adoption of HCW, but also other guidance within the wider system. So a key part of that was allowing some of the health boards to start using AMAT, a guidance monitoring software. And we hope that that has helped the tracking and adoption of our guidance, but also supported the same for guidance from NICE and other bodies as well. So next slide, Katie. So just to start talking through some of the key findings that pilot report has within it, I think a really key thing for us was ensuring that the process we were putting forward was feasible, acceptable, and we think that we have delivered a process that does do that while also providing valuable insights. So we were conscious that there are lots of requests for data from across the system, and we didn't want our ask to be too onerous, but we still wanted to ensure that we were getting valuable insights back. And the kind of feedback that we've had and what we've been able to provide within that report, I think is a good signal that we've achieved that. So that's been really positive. Within the pilot, we are also interested, and going forward, we'll be interested to hear about the awareness, the clarity, and the impact of our guidance. And within the pilot were some of our very first guidances, so including our very first guidance on mechanical chest compression. And despite these guidances coming from the very early days of HCW, we found that there was good awareness of the guidance, there was good clarity, and that guidance was having an impact on decision making. I think for our first set of guidances that went into the pilot, we see these as acceptable kind of responses, but going forward, we would obviously want to make sure that there is full awareness of our guidance as it's published, and that all of our guidance is clear, and that's work that's continuing for HCW and a really important thing for us to learn through this adoption audit process. And next slide, please, Katie. Then obviously a really key aspect of this pilot has been to learn about the actual adoption of our guidance. And given the responses we had from across the local health boards and the other commissioners, we think we can kind of split this into 3 kind of overarching groups. The first group is really positive. We saw that some of our guidance had really clear adoption. There's also a clear impact of our guidance on decision making as well. So Matthew talked about mechanical chest compression and the potential impacts that that could have. And through our adoption audit process, we were able to learn that our guidance was taken to decision-making forums, that it had an influence on the decisions that were being made and helped decision-making. There are also examples there of adoption with clear impacts where we've made positive recommendations for routine use as well. So the pilot also allowed us to identify this group where there was an intention to adopt, but there were barriers to adoption that were present. A really good example of this one is sacral nerve stimulation. So we heard from partners in the local health boards that they were keen to provide this for their patients. They had explored providing it by some of the boards which are able to provide this service, and they'd looked at paying for services in England, but within their local health board, the patient numbers were too small to justify a specific service within that health board. And we were able to take those messages and provide them to Welsh Government and back to NHS Wales. And we hope that that stimulates some thought about whether these services need to be delivered in a regional or a national way within a single health board. Then we also had this group where there was limited adoption or limited impact. And there are a couple of reasons for that. So for cardiopulmonary exercise testing, there was a feeling that the evidence was quite mixed and our guidance could perhaps have been clearer. And so there'd been limited adoption of that guidance. And that's really important for us to hear so that we can improve as we move forward. And then there was another example, which is continuous glucose monitoring. There was a feeling in the responses that we received that actually this had already been adopted by the time that our guidance was published. And so our guidance had had a limited impact. but there was still some reporting that had been helpful in removing the final pockets of resistance around that. So it still had some value. Next slide, please, Katie. So we felt that was a really successful pilot, and given the feedback we've had, we've now moved that into an annual reporting system. So we have recently sent requests for information for another set of guidance, 5 from guidances that we didn't include in the pilot period, and then 6 more recent guidances which have had some time to embed in the system. We've made requests for information with a deadline in February 2023, and we look forward to receiving those. In this version of the annual adoption audit process, we've also included NICE guidance for the first time. So we asked the Welsh NICE Health Network which guidance for NICE was a priority to be included, and we've been able to include 3 examples of that to get a sense of how NICE guidance is being adopted. And we're aiming for completion across guidance from all of the respondents that we've asked responses for, and we'd encourage you to work with local health boards to help us do that. And next slide, please, Katie. And we're also thinking about the future adaptations that we can make to the adoption audit process to ensure it continues to improve and adapts to our needs. So we currently have social care topics under appraisal, and we're working in partnership with Social Care Wales to consider how we consider the adoption audit process within social care. Part of that will be planning a workshop in the new year to discuss issues around the appropriateness of the adopt or justify status within social care, and the practicalities of working within a system that has many more providers and has much less centralised decision making. And generally, we're keen to ensure that we strengthen this process over time, and we're responsive to feedback. So we'll work with partners continually to do that. And we'd encourage people who've had experience of working with us on this or have thoughts about the adoption audit following the publication of the report to get in touch so that we can ensure we continue to do that. So thanks very much.
Thanks so much, Gareth. This has been a really interesting piece of work and one that's added lots of value. And just sharing the findings, I think, sets the context very nicely for our next session, which is the adoption panel session. So Dr. Raj Krishnan has kindly agreed from Swansea Bay University Health Board to chair this panel session, and in particular to discuss 2-3 questions. So why is adoption important? What are the role and the views of key adoption stakeholders within Welsh care systems? And how can they collaborate to ensure that HEW's national guidance and indeed NICE guidance is adopted? So Raj is also Clinical Officer for Clinical Standards and Improvement with the Royal College of Paediatrics and Child Health. And previously he was, until recently, the Associate Medical Director for Quality and Safety at Cardiff and Vale. And he's also Consultant Paediatric Nephrologist at the Children's Hospital for Wales. So I'm going to pass over to Raj for this more interactive session. Over to you. Thank you, Raj.
Thank you, and good morning, everyone. Thank you for the kind introduction, Susan. So, I should say, for me, looking at HEW, it has got multiple importance, and it actually was highlighted first by Matthew when I was looking at the northeast corner for the cost effectiveness plane, and also what Gareth was actually touching upon, especially with regards to adopt or justify. So the fact is, I just do have 4 panel members, and if you actually look through the slide, you can actually say they come from different sections of the NHS and the healthcare system. So I'm just going to call out their names so that the fact that they can introduce themselves. So I'll start off with David Evans. David, do you want to introduce yourself, please?
Hello, good morning. My name is David Evans, Deputy Director for Life Sciences and Innovation at Welsh Government.
Thank you. And moving on to Lisa Davis.
Morning, everyone. Lisa Davis. I'm the Head of Effective Clinical Practice and Quality Improvement in Hywel Dda University Health Board.
Thank you. Dr. Andrew Champion.
Good morning, everybody. I'm Andy Champion. I'm the Assistant Director of Evidence Evaluation at WISC. WISC is Welsh Health Specialised Services Committee. Thank you.
And finally, Dr. Lisa Trigg.
Thanks, Raj. Morning, everyone. I'm Lisa Trigg. I look after research that's missing, but research data and innovation at Social Care Wales.
Thank you. So I'm going to start off with Lisa Davis as well as Lisa Trigg. And my question, again, I'll start off with Lisa Davis, is the fact that, why is adoption important? And especially in this time and climate, where we are actually faced with huge pressures from not only from economical pressures, but multiple pressures. So why do you think adoption is important, Lisa Davis?
Thanks, Raj. Yeah, and I've been thinking a lot about this question, and particularly, as you said, the pressures on the system at the moment. And I think the Minister summed it up quite nicely earlier when she said about the importance of benefits for the patient and value for us as a health board. And I think Health Technology Wales is going to enable us to adopt different and new ways of working that are going to help us in our, addressing those pressures and, looking at working more efficiently and effectively. In particular, some examples that I've been thinking about, recent publication of Health Technology Wales guidance in relation to outpatient laryngeal biopsy, which we're looking at here in Hywel Dda, because it enables a shift from procedures undertaken under general anaesthetic to local anaesthetic. And that is not only better for patients in terms of improved outcomes, but it also means that we're able to see more patients more effectively and more quickly. So obviously that has an impact on our recovery plans post-pandemic. Another really effective example of that is the fit testing, which was the subject of the annual adoption audit, because it means more safer and more effective referral to secondary care. And again, looking at our kind of waiting lists and backlogs enables us to see patients. And then that got me thinking about how Health Technology Wales fits in more widely with our strategic objectives here in Wales, and in particular, things like the duty of quality. And at the moment, we're working towards those 6 domains of quality, safe, timely, effective, efficient, equitable, and person-centred. And I think Health Technology Wales guidance, works towards a lot of those. In particular, at the moment, when we're looking at the current adoption audit, and Matthew mentioned earlier, Health Technology Wales recommend what we shouldn't be adopting as well as what we should. So that feeds into the kind of safety element and a lot of what Sally talked about earlier around kind of effective, efficient, and equitable, around value-based healthcare. And finally, I think one of the most important, and the example given earlier around the Freestyle Libre, is patient and person-centred, and what makes things better for our patients first and foremost. So yeah, in terms of the benefits, I think that's what I would say from a health board perspective.
Brilliant, thank you. I mean, I think the fact is, as you've written, summed it up, is what Dr. Sally Lewis was also talking about, is getting those outcome measures too, which is actually quite going to be very important. So, Lisa Trigg, the fact is, social care is also, not without any pressures. It's got huge pressures actually coming on. And my query, and especially for someone who sits in a health board, how do you actually adopt that in the social care settings? Because sometimes the healthcare colleagues really don't know much what actually happens. So how do you do that? And why is it important to you?
So I could talk about this all day, but I'll try not to. My colleague Sarah McCarthy is about to present about social care, and she'll talk a little bit about some of the issues around the structure and why it's so difficult in terms of structure and systems and how many different organisations are involved. So we don't underestimate the challenges in healthcare. We're not under any illusions about how easy adoption is, but we do have some, fragmentation and also some other issues that Sarah will talk about. For example, about 30% of social care in Wales is actually funded privately. We don't actually know how much is funded privately because obviously people never come near our system, but we think it's about 30%. So that has all sorts of difficulties. And the importance of adoption, I don't think there's anything on my list that hasn't been mentioned already. I mean, the first one is necessity. So under huge amounts of pressure. So the need to be innovative and adopt new models of care has never been greater than it is at the moment. People have talked a lot about outcomes. For those of you in healthcare, you may not be very close to the Social Services and Wellbeing Act, but the way that we legislate and the way that we manage social care is supposed to be all about outcomes and all about what matters most to our citizens and people who use care and support. And to do that, we need evidence and innovation and to really sort of drive that forward. And then you just talked about a duty of quality, Lisa. I don't know that we'd refer to it that way in social care, but there's almost like that moral imperative, which is particularly as we have such a fragmented system and we have a lot of people paying for their own care, we have this moral imperative around equity. There shouldn't be so much variation geographically or across funding or across settings or across needs. So that I don't think any of those are anything people haven't talked about in healthcare, but we probably frame them and use different language to healthcare.
Brilliant.
Thanks,
Thank
Raj.
you. No, thanks for that. I think the fragmentation is actually quite a key thing, isn't it? And that variation. I mean, even if you look in one particular health board, you can actually see quite a lot of variation within that too. So, yeah. So I'm just going to move on to the fact that about what each of us have to play, and I'll actually start off with David and basically saying, you sitting in Welsh government, David, how do you see? What do you think of the roles of different actors? How can they actually make sure that adoption is actually being brought about?
Yeah, thank you, Raj, and morning. I think it's an interesting question, isn't it? What part do actors need to have to play, really? I suppose, like all actors, it's for me recognizing that you're a part of a play, or you're part of one innovation ecosystem in Wales, which I think in this space we all know is made up of lots of organisations. But it's all about people at the end of the day. So I suppose the one word keeps coming back to is, how do we get the coherence in that ecosystem? And I like to sort of use simple mantras, really. So some questions I ask myself there is three questions really. Are we all focusing on a common goal? Are we all delivering to the strengths of those around the table? And are we celebrating success together? Because in that sort of common goal, you'll have heard from the minister, Welsh Government, yes, a healthier Wales. I think it's Welsh Government's role to try and create that supportive sort of environment for the ecosystem. I saw Abby on earlier, Abby Phillips. So there's a new integrated innovation strategy coming out from Welsh Government. But then if you look at other parts of the ecosystem, have we got a clear pull? So health and social care, really, really clear what those priorities and what those needs are that they want to, draw through into adoption. And then, once we've got those, the sort of the push side of this, all the assets, everybody who's, HealthTechnology Wales, everybody else, how are we, drawing those innovation opportunities forward? Not sort of delivering our strengths around the table. Are we asking that question? Are we all adding value and not duplicating? You know what I mean? And do we know, who else to bring to the table? So it's great, listening to, how Sally was talking about how the Value Centre will work with HealthTechnology Wales, on those sort of, common goals. So it's more of that. I suppose the last bit around, are we celebrating success together? There's something, I've heard quite a lot this morning is, have we really got one voice on the impact, and where the real opportunities are to overcome what are, very natural challenges to adoption? So is that, and that's celebrating is having that one voice, and then recognizing, are we rewarding people that manage to adopt things, not just recognizing, the next new shiny thing? So some interesting thoughts. Be interesting to see what others think, Raj.
No, that's brilliant, because the fact is I completely agree with regards to the common goals and also the working to the strength. Because the problem, when I look at it, it's we are actually not aware of each other's strengths, and that is when we are actually missing it. So, but at the same time, having a patient focus or actually having a focus around the people will actually help you to get there. But again, when it actually have that collective celebrating success is again something that we miss. We do that on an individual basis. It doesn't actually happen on a collective basis. So I'm just going to go off to Andrew Champion. And Andrew, you sitting from a WISC side, how do you see that? How, am I right to say that the fact that you're actually better placed to get adoption and make sure people work together?
Thank you, Raj. I don't know if I've been better placed. I think what we've recognised over the years is that we really need to have a very good process in place to ensuring that guidance, whatever guidance it might be, HealthTechnology Wales or NICE, there's a good process in place to enable that guidance to be put into practice. There's many barriers and challenges to that process, but at WISC we have an advantage as well, that we're a single commissioning body for specialised services in Wales. When guidance comes out that's relevant to us, we can produce one document, one policy that's relevant for the whole of Wales, whereas the health boards are faced with well, they're potentially producing 7 different policies or interpretations of that guidance and how it's implemented. So we have that advantage, which is good. Perhaps if I just give you a very quick example of something that's happened recently. We had the guidance from HTW that came out on autologous stem cell transplantation for people with relapsing remitting MS a year or so back. This was a topic that we referred because we recognise through talking to clinicians and patients and other colleagues, healthcare professionals, that there was an unmet demand for this treatment. And the existing WISC guidance on this topic was over 10 years old. The evidence hadn't been updated for that long. There was great uncertainty about its benefit and its value. It's a really high cost intervention. We needed to have a good decision about this. So we sent our topic away to Health Technology Wales. It was approved for appraisal, went through the process, and we had a positive outcome in terms of the guidance recommendations. But then that's not the end of the story. We then have to put that into the WISC prioritisation process for funding. This is one topic amongst many others we have to then consider for funding on an annual basis every year. It's almost a competitive process. Which of the topics that we have at WISC every year that come through, new topics, are we going to fund from a very limited budget? So we put this through our prioritisation process, which is a well-oiled machine here at WISC, which we've been running for many years. And it was scored as a high priority and it was then funded in our commissioning plan for the next year. Final step in the process would be writing a commissioning policy and a service specification. That work is now underway and almost complete. We've identified providers now in London and in Sheffield to provide this treatment because we couldn't, unfortunately, provide it here in Wales. And 2 patients are now being referred. So that's the story. That's what can happen with guidance from the very beginning to the very end. And I think that's a really positive story. And if we can do that as much as possible to ensure that high value, cost effective, clinically effective treatments that HTW have appraised and approved are brought into practice, and I think that's what we're trying to do here at WISC.
So my question to you back is, Andrew, is the fact that if I am coming from a health board perspective for a commission service, do you think it'll actually hit a higher rank for the prioritization panel if it actually went through the HTW process?
Looking back at our various panels over the years, yes. So if we've got a really high quality piece of work, such as HTW is able to produce, then generally speaking, it does have a more favourable outcome. But that's not the whole picture, because the panel is looking very carefully at the clinical and cost effectiveness of these treatments, but also looking at broader aspects as well. We have a wide range of scoring criteria, which we assess each of these different proposals every year, and it goes beyond just clinical and cost effectiveness. We're looking at sort of health inequalities as well, the burden of disease, the severity of disease that we're looking at, a whole range of different criteria. So it's not just those 2.
Okay, no, thanks for that. I mean, I'm just moving on to the next question, and I should say, I'm just taking back from what David has actually mentioned about the common goals and the strengths. I mean, and the question is, how can we actually work together and to make sure that the guidance is actually brought about? So I'm going to start off with Lisa Davis again, and the fact is, from a health board perspective, Lisa, how do you see this? That the fact that we can actually bring the guidance is adopted, actually making sure that we are actually working together.
Thanks, Raj. Yeah, and as Gareth alluded to earlier, in terms of the adoption audit pilot, we were one of the health boards that responded around the sacral nerve stimulation to say we'd love for our patients to be able to access this, but unfortunately, because of our situation here in West Wales, we're not able to provide a service at the moment. So I think we do need to work more closely together regionally and nationally as health boards, and working alongside WISC to look at how we can develop models, commissioning arrangements to provide services, equitable services for our patients in Wales. And I think one of the benefits we do have, and again, Gareth mentioned it earlier, is the AMAP system that we're very grateful to Health Technology Wales funding to enable us to have a single system. Almost, I'm conscious that not all health boards or trusts are using it, but we have a system that enables us to collate information around adoption in a central place, and we are working as a national group to be able to hopefully share information a bit more effectively about who is adopting and who isn't, and that might open up conversations around how we can refer our patients and work as a whole nation rather than a kind of set of individual health boards. And I think that would really help us to adopt that a little bit more. And just another thing to say in terms of, sorry not to mention the barriers, but kind of the interesting thing about how we work in Wales is what one of the recent guidelines that was published around SABR for renal cell carcinoma. Here in West Wales, we would potentially have a patient who would be eligible for that treatment and who we'd want to receive it, but they're under the care of an oncologist in Swansea Bay, and then the treatment would be received in Cardiff. So it's not just 1 to 2 health boards, you know, it's across the whole of South Wales that we'd need to work. So there are examples where we can't adopt, or we wouldn't put a service in place because of tertiary provision, but we'd still want our patients to benefit from it. So we have to work really closely with colleagues in other health boards to ensure that they are looking at the adoption and they are able to provide the service if they are, or justify why they can't. So it is a very kind of one Wales approach, and we are, I think, working really well as a nation in terms of the adoption of the guidance.
No, brilliant, thank you. And I think I've got to thank HTW for giving the support for the AMAT system. So if I'm not mistaken, out of the 7 health boards, 6 have actually got it. And my query always is the fact that if there is a guidance that's coming out, can it go directly onto the HTW then? It makes life a lot easier for things, and especially with the NICE, which is also quite a lot of guidances which is coming out, which is quite difficult to keep up. I can see a question that's actually come up from Rajendra Cadell, but we'll definitely answer that after we finish off the discussion. And for colleagues who are actually on the call today, just make sure that if there are questions, just put them on the chat bar, so that we could actually continue with the discussion too. So I'm just moving on to Andy. And Andy, how do you see? I mean, again, you did touch upon this quite heavily on before when you were actually talking about, you know, the guidance that's been adopted. How can we actually work together? I mean, this is where I was actually saying, are you strategically placed, saying that, making sure you're like the orchestra conductor who's basically saying, you know, this health board is doing that. And is that how you see yourself there?
Well, I don't know about myself, but certainly the team here at WISC, we do. I think it's really important that we work across these boundaries and work collaboratively. And I think we do that quite effectively here at WISC. I'm just commenting on Lisa's last comment on SABR or SABR for renal cell carcinoma. That's a WISC commissioned treatment. And we're looking very carefully now to ensure that that service is enhanced in order to develop a whole new raft of indications for SABR, which is a very important treatment options for patients with cancer. So that's really important. I think for us as well, it's all about getting the guidance into practice is vital. I just wanted to touch a little bit about the guidance itself, and we've discussed about this before. We at WISC, we have to convert the HTW guidance into meaningful policy commissioning decisions, and so we're looking at, you know, having a population that's been well defined, what the eligibility criteria are, what the stopping criteria are, what the time to treatment should be, some of the key outcomes that we need to collect for particular treatments. So it might be just some feedback for HTW really, in future guidance, to help us a little bit more in shaping that from the evidence that's been appraised, because it'll help us enormously then when we come to shape our policy. And because we talked, I think Sally mentioned earlier about scope creep, and we want to ensure that we don't go outside the boundaries of what the HTW evidence has defined around clinical and cost effectiveness. So I've stepped away from the question now a bit, Raj, but I just wanted to get that point across, actually, how helpful that might be to us, to all of us, actually.
No, thanks for that. I should say the fact is, you know, from an eligibility criteria, I mean, I'm a person who basically looks at and says, if you do have any business case that's actually going through, and this is something that I always try to push through and say, how do you know it's actually effective? Where does it lie on the cost effectiveness plane? Where does it actually come with regards to the quality side of things too? And I think, and this is where I'm actually grateful for HTW again with regards to the open call. So colleagues, if you haven't actually used the open call, use that. Actually, it's a fantastic opportunity. It's free of cost, actually. The fact is, HTW will do the work for you, will basically say whether it's cost effective or not. And then when you do have a business case in your health board, it is very difficult to actually make sure if it is actually cost effective, then it's very difficult for the health board to say no to that. And it could be even the commissioners too. So I'm just moving on to the, how can we support the system? And I think the fact is, as I said, the challenges are huge. And also, as David has actually touched upon before, there are actually different stakeholders here, or different multifaceted healthcare is. So I will actually start off with you, David, as the fact that, how can we actually support, how can we get the system to make sure that adoption is supported?
Thanks, Raj. Well, I suppose that's a $64,000 question, isn't it? Which we'd all like a silver bullet to, I think. But I suppose 3 or 4 points in there again for me. So I think it does go back to that sort of start with a clear need, because adoption is about change, isn't it? And it's about change and transformation. So, we need to tie better together effectively that there's a clear need here that's going to be drawn through the system, on the back of that. I mean, that's the second point, I think, then is, there's something around building the capacity. This isn't going to happen, by chance. So there's that capacity, in the sort of ecosystem and to support that. And that probably, that capacity is needed at all levels. I think linked to the capacity issue for me, I'm because it's about change. I'm a strong advocate. This is about culture, and we're in a highly regulated, risk-averse sector. So that even doubles down why I think culture is sort of really really important. So there's something there about how do we get the mix of top down and bottom up. Top down, if the board isn't looking for an innovation strategy, then that's not sending the right signals. And from the bottom up, how do we make sure that those that invest and support innovation get some benefit in their department or those sort of issues? And that innovations around change. I keep hearing that people say it's very hard to run sort of the parallel of running what you're doing now and how you bring in new systems, etc. And I think coming back to that culture issue, it's really listening to people's views around. Some people want a stronger tell, which is adopt or justify, versus is that what will get some of this adoption through. So I still think the fourth point for me is around sort of monitoring and evaluation, coming back to that one voice. So, that's one of the strengths I think we've got from HealthTechnology Wales, and we heard, earlier, from Julian things around Libra, what I mean, that there is something there, but it's not perhaps as fully adopted as it could be. So, we need to understand that storyline, where is that, and particularly around impact and uptake, and in a way, I think then how do we get that sort of storyline in the language around cost effectiveness, in a cost-driven world, etc. So not easy, but I'm sure there are a number of areas there which we could explore. Have we lost you, Raj?
I think we may have lost Raj, so I'm just going to invite other members of the panel to chip in as they see fit, and hope that Raj will join us again shortly.
Can I pick up on that one, Susan? I think
sure.
So, David, your points about change, and this is not necessarily about a technology or a device. So we, social care has specific issues because a lot of what we're trying to adopt is how practitioners interact with people who use care and support, and have a very strong tradition of co-production in social care. So, it's not just about the practitioner, it's also about the person they're supporting. So we've had to do a lot of thinking about how we support change and different ways of doing things in social care. So we have kind of 4 pillars of work that we're focusing on. One is dissemination, so what you just referred to as kind of, just tell, adopt and justify. Another is exchange, actually bringing people together to talk about different ways of doing things. So, workshops, conferences, webinars, those sorts of things. But the other 2 pillars are the ones that we think is really where the magic happens. So the third one we call brokering or convening. And this talks to, I think, Andy's point about joining the dots and seeing what those strengths were. Sorry if I picked up that from the wrong person. But brokering and convening is about really joining the dots, stopping duplication, but just supporting people to be in touch with each other. Sorry, the cat didn't get the memo about the panel. So what the kind of approach we use for that is we're really starting to focus on supporting communities of practice. So we've got a digital community management platform that we're using to try to set up and run communities of practice to bring people together to talk about evidence and innovation and all these different ways of doing things. And then the final one for us is the kind of, as far from the dissemination end as you can get, which is co-creation. So bring people together to look at the innovations, come up with their, the ways that they're going to adopt them, what works for their own practice, and to really kind of respect the fact that there is a balance, and, getting this balance right is key, between formal research evidence and practitioner wisdom and data and other insights. I suppose you could regard that as part of research, but also importantly, the perspective of the person who uses care and support, which in social care is, I know that we say in healthcare, being person-centered is, kind of the end goal. But, if you imagine that every interaction in social care is co-produced, so, you can't force a social care interaction on someone. Well, you can, but it doesn't work out very well. So we've got a whole army of people, that's kind of overstating it, a small team of people working on these different approaches. And also, how do we build the skills and capabilities of people working in social care to take on some of this stuff? But it really is very much for us moving away from the doing to practitioners and organisations and moving very firmly towards doing with and working alongside them to really understand how to do some of this stuff. One of the organisations that we're partnering with now is some of you will be aware of the Developing Evidence Enriched Practice programme at Swansea University that does brilliant work about helping people to understand new ways of doing things. And we're also recruiting some innovation coaches to help work on some of this stuff. So we see it, like all of you, as essentially a very complex change process. There is no such thing as a simple adoption decision, but it gets more and more complicated the more you move away from a treatment or a device through to how does somebody actually interact and support and come up with innovative ways of, supporting the person with learning disabilities or with dementia or with, terrible issues around poverty or so. It's that $64,000 question and one that keeps us awake at night.
Thank you, Lisa. Welcome back, Raj. I think we need to draw stumps there, so I don't know if you just want to conclude on behalf of the panel.
No worries. Thanks for that. I have to say, I'm not sure. I had a question for Lisa Trigg, and my query was with regards to, how do you make sure adoption is actually happening across a wide spread, geographically spread health board, and what are the challenges you face, and how do you actually come over that actually?
Yeah, so you missed my spiel, Raj. Me talking about all of the things, and you missed. But can I just add, because Rajendra asked a question in the chat, just very quickly, we do struggle very much with individual level data across adult social care and children's social care. But a really exciting thing we're doing at the moment is working with Administrative Data Research Wales and the SAIL Data Bank to try to promote data sharing. And an example is that we're just recruiting a researcher with SAIL to be seconded to Social Care Wales to encourage local authorities to provide adult social care data. So there's quite a lot going on there. So Rajendra, get in touch and we can have a chat about data and SAIL and social care.
Brilliant. Thank you. I should say it's actually nearly 11 minutes past 11, and I'd like to thank all the panel members for the contribution this morning, and would like to hand it back over to Susan.
Thank you so much. It's really encouraging to hear some of the value that HEW work has added, and I was attracted to David's point about knowing your strengths, and I guess I'm just going to make our pitch here. HEW's strength is the evidence. So anybody out there that's got a topic that they really want a focus on, clinical and cost effectiveness from some of the best teams in the world, then send it to us. We'd be delighted to receive it. So thanks very much. And with that, we're going to move into a short break. So if I can encourage everybody to step away from the computers just for a brief 10 minutes, and we'll reconvene back here 11:20. Thank you so much. Speak soon. Okay, so it's 11:21 now. So if we could make a start on the final couple of sessions, that would be great. Welcome back, everybody. And next, we want to outline HEW's work that supports innovation. Wales has developed an enviable innovation ecosystem that contributes much to health and wealth policy ambitions. And we consider ourselves to be an integral partner within that system. And we look forward to contributing to the delivery of the forthcoming Welsh Government Integrated Innovation Strategy due to be launched next year. But innovation is of course delivered in partnerships, and so in this session we'd like to outline both HEW's innovation offer, but also some of the key partnerships that we've formed to take forward the innovation agenda. So our first speaker, and it's my pleasure to introduce Sarah McCarthy, who's the Director of Improvement and Development at Social Care Wales. And she's going to get us started by outlining our partnership working with Social Care Wales. So Sarah began her career as a youth worker in Wales, where she worked in a variety of settings with vulnerable young people. She went on to become Director of Skills for Care and Development in 2008, and she joined Social Care Wales as a Director in 2016. So over to you, Sarah. Thank you.
Diolch, Susan. Sarah Dwi from Gofal Cymdeithasol Cymru, and I'm really pleased to be joining you today to talk about some of the work that we've been doing with HealthTechnology Wales as part of today's celebratory event. So if I could just move on to the next slide. You've already met my colleague Lisa, and she started to touch on some of these areas, but we just wanted to start off really with the vision of Social Care Wales, just so you can understand the perspective that we're coming from, and we're conscious there may be a number of colleagues joining the event today that perhaps work in more health and social care settings. So I'm going to give a little bit of context within the time that we've got available today. But I think our focus is really on how social care can make a positive difference for the care and support of adults and children and their carers in Wales. So if I could just move on to the next slide. And I think it's probably just important for us to outline the role of Social Care Wales. So we are the workforce regulator. So we regulate social workers, social care workers, residential childcare workers in terms of their professional registration and support. We also have a role in workforce development, like HEIW, supporting the development of the workforce, supporting employers with workforce development across the whole of Wales. We also have a service improvement role. We work with partners like Improvement Cymru, and we also work with a wide range of social care partners to look at how we can support improvement and services. And you've met Lisa, who heads up our work on research, data and innovation. We're working with key partners like Digital Health and Care Wales, Life Sciences Hub, HealthTechnology Wales and many more in how we support the social care sector with those functions, and really look to provide national leadership and expertise in social care and early years and childcare. And we work with a wide range of partners, practitioners, employers in order to do that. So if I could move on to the next slide, please. Lisa mentioned briefly, I think, some of the opportunities and challenges when we look at the work of HealthTechnology Wales for the social care sector. And I think there's an overarching challenge here overall about how we identify and use notable practice and evidence in all of our work. So local authorities are really close to citizens. They're locally democratic accountable organisations, so they're close to the citizen, but it also means that we've got 22 autonomous organisations working in Wales. Now, most of social care services are either commissioned by local authorities or health boards to some 1,000 plus independent providers. Those are third sector providers, private providers, and as well as local authorities having their own service provision. But we've got a wide range and a real creative mix of services within the sector. Lisa also mentioned self-funders, so a number of individuals will procure their own care and support. You may well have done that for your own families, whether that be care and support in the home, whether that be in a care home. And what you'll find in social care, which can be a little bit different to health as well, have private paying residents living alongside publicly funded residents within some of those care settings. There is a wide range of diverse provision within social care, and that is being innovated all the time to respond to what the needs are within communities and how best to organise our services. So it includes domiciliary care, so that's care at home, many of you might be aware of, also includes care homes, but also things like supported living, where people are living small organisations, children's homes, foster care, and I could go on and on around those services. I think what we wanted to just be really clear on is that what drives social care is what matters most to individuals, what matters to the individual and their carers, what is most important for them to be able to do. And we can't assume as professionals that we know what the answer to that is. For each of us as individuals, that will be really different. And social care has got a role in enabling children and adults to do what matters most to them. So if I could just move on to the next slide. Obviously our focus today is on our partnership with HealthTechnology Wales, and this is a long-term and collaborative partnership across the two organisations. We have a role, and I chair the HealthTechnology Wales stakeholder group, where HealthTechnology Wales really wanted to bring a range of stakeholders together to really inform, influence their work, and they've been really responsive to receiving feedback and looking at ways that they can change their approaches to meet the needs of both health and social care. We're also a member of the appraisal panel, so we can ensure that there's a social care perspective into those appraisals. And we've also worked together then to really think about how the HealthTechnology Wales offer can work better for social care and social care topics, recognising some of that diversity of the sector. So if we could move to the next slide. So what have we done to try and improve how we work together? Well, we focused on asking people what was important to them, just as we would expect our practitioners to do every day. So we started off with a roundtable event with senior stakeholders. There was also then events and workshops with practitioners and individuals with lived experience, asking them how can we best improve and work together. We worked on and then actively promoted the recent social care topic call, and we thought really carefully about how best to start progressing and supporting those social care topic calls. And now we're planning an adoption workshop with practitioners, recognising with the context I set out about how social care is configured in Wales, to really think about, well, what does our adoption mean in that context, in terms of the breadth of our current service provision and the organisational support structures that are in place. So if we could look at the next slide, please. And I think in terms of then the feedback, we thought it was really important to share what some of the feedback has been from practitioners and individuals with lived experience when we've undertaken workshops through with them. So you can really understand the energy, the passion that there is for individuals and organisations to want to work with health technology appraisals and things that we can understand to improve and develop what we do. So those, I think, is a word cloud of positivity that we see in front of us here this morning. So if I could just go to the next slide, all we've done then is include our contact details. So if you want any further information or to get in touch on a one-to-one basis, then you've got those details there. Diolch.
Thanks so much, Sarah, for that helpful overview of our recent collaborations. I'm just going to sneak in one question before we move on to our next speaker. And the question is, what do you think are the biggest challenges with the appraisal of social care related topics?
Yeah, so I think there's a number of challenges. I think firstly, there's not as much evidence perhaps in social care as what there is in health traditionally. So part of what Lisa said in terms of her role is also looking at research. We're looking at how we can drive the research priorities of the social care sector and to get research undertaken in the areas where it doesn't exist. And you'll be aware from a number of the appraisal topics, we can't always get the evidence that we need in order to be able to do an evidence appraisal. I think there's also a challenge for us that in social care, we look at the person in the round. And so it's hard sometimes to do an evidence appraisal on the specific because our interests tend to be on the pathway and journeys and lifestyle that individuals are looking for. And so that I think is also a challenge in how we approach the topic process. And I think we've also had a challenge, and we're working hard together on this, about what the perception of technology is within the social care sector. That tends to be quite a narrow view, quite often digital, as opposed to really thinking about the sort of broad definition of technology that HealthTechnology Wales uses. So I think those would be my top three.
Thank you, Sarah. That's really helpful. So we're going to move on to our next speaker now, and we're delighted to welcome Ivan Evans, who's Executive Director of Digital Strategy at Digital Health and Care Wales. And he's going to tell us a little bit more about partnerships in the digital space. So just to say that Ivan will be delivering his presentation in Welsh today. So to access the live English translation, please follow the instructions that were sent yesterday in the joining instructions or have just been posted in the chat box. So over to you, Ivan. Thank you so much.
Diolch yn fawr iawn, Susan. Mae'n hyfryd ymuno gyda chi heddiw. Diolch yn fawr iawn am y gwahoddiad. Gobeithio bod chi'n hoffi fy nghefndir Nadoligaidd. A mae'n ddrwg da fi bod fi ddim wedi medru ymuno gyda'r digwyddiad o'r cychwyn. Wedi bod mewn sioe Nadolig Ysgol Gymraeg, oedd yn hyfryd iawn. Ond mae'n falch bod fi ma'n hawr heddiw. Wyta gyntaf, cyn i fi weid dim byd arall, jyst crongyfarch technologi iechyd Cymru a be maen nhw wedi cyflawni yn y 5 mlynedd cyntaf. Mae wedi bod yn gyflawniad arbennig iawn. O'n i'n ffodus tra bod fi yn y Llywodraeth i fod yn rhan o sefydlu technologi iechyd Cymru a gweld sut mae'r sefydliad a'r gwaith wedi datblygu o dan arweiniad Susan a Peter. Wy'n gwybod bod aelodau o tîm y Llywodraeth ar yr alwad fan hyn hefyd, ond wy'n credu bod y sefydliad wedi gwneud cyfrannau pwysig iawn yn gyffredinol ond hefyd yn arbennig yn yr ymateb i'r pandemig Covid a wedi gosod patrwm clir iawn a wy'n croesawu'n arbennig sut yn y flwyddyn diwethaf mae hwnna wedi cyfleidio digidol a nais o'n tipyn bach mwy am hynny. Wy'n oedi i'r cyfieithydd fel bod fi ddim yn mynd yn rhy gyflym as wy'n siarad yn gyflym iawn a wy'n hapus iawn i gymryd cwestiynau yn Saesneg neu yn Gymraeg ar ôl y cyflwyniad byr. So wy'n gyfarwyddwr strategol gyda gofal iechyd digidol Cymru. Ni yw'r corff cenedlaethol yng Nghymru yn yr NHS yng Nghymru ar gyfer darparu gwasanaethau digidol a data. Mae bron yr holl o'n gwasanaethau ni wedi darparu i ddefnyddwyr proffesiynol ar draws ysbytau a gofal cychwynnol. Ond i ni yn ystod y flwyddyn nesaf yn mynd i fod yn lawnsio app sydd yn darparu gwasanaethau yn uniongyrchol i gleifion trwy'r NHS Wales app newydd sydd ar hyn o bryd mewn cynllun private beta gyda 1,000 o ddefnyddwyr jyst yn profi'r technoleg a profi'r app i wneud yn siŵr bod yn gweithio yn effeithiol. Mae hwnna yn datblygiad cyffroes iawn i ni a mae hwnna yn un o'r meysydd lle mae yna gyfle i ni weithio fel partneriad gyda Technoleg Iechyd Cymru a gyda eraill. A be weithiau jyst sôn am yw 2 faes arbennig o ran partneriaeth. Felly y cyntaf yw offer technegol a digidol i hun adnabod cyfleoedd i ddefnyddio digidol i fedru darparu gwasanaethau yn fwy effeithiol. Fel nes I sôn, mae yna waith wedi digwydd dros y flwyddyn ddiwethaf fyna, bydd yna weithdi mewn partneriaeth gyda'r hwb gwyddorau iechyd a Life Sciences Hub a HTW a DHEW a DHEW, Digital Health Ecosystem Wales, I gyd yn dod at yn gilydd mis Chwefror, mis Mawrth eleni, jyst I adnabod y maes a cael gorolwg, a wedyn bydd yna alwad agored ar gyfer technolegau digidol yn yr haf mwyn rhoi I HTW y cyfle I edrych ar beth falle sydd yn gyfle arbennig I edrych mewn. Fel falle sydd wedi cael ei sôn yn barod, mae HTW eisoes wedi gwneud ymchwil ar Freestyle Libre a wedi darparu cyngor i'r NHS ar draws Cymru a wy'n credu bod yna nifer o gyfleoedd yn y maes hynny. Yr un peth wi eisiau pwysleisio yw bod angen gwneud hynny mewn ffordd gofalus, hynny yw eitha targedig. mae cymaint o offer digidol, cymaint o apps i gael, cannoedd o apps gwahanol jyst i ymateb i Covid, er enghraifft, does dim modd gwneud asesiad o bob un ohonyn nhw. Felly mae'n bwysig iawn bod bobl yn cyfrannu syniadau tuag at y broses, a wedyn bod HCW yn gallu defnyddio'r prosesau galwad agored sydd ganddo i benderfynu ar beth sydd fwyaf priodol i asesu, lle mae yna dystiolaeth, a beth sydd yn rhoi gwerth ar draws y system. Felly fi'n credu bod yna ardal bwysig fyna i ni barhau i ddatblygu yn partneriaeth. A wedyn yr ail yw sut i ni'n olrhain beth sydd yn digwydd yn dilyn argymhellion gan HCW. Felly wi'n gwybod bod HCW wedi bod yn gweithio yn agos iawn gyda y rhwydwaith o gyfarwyddwyr meddygol, yn dechrau wneud gwaith ar audit, i ba raddau mae byrdde iechyd a darparwyr gwasanaethau wedi cymryd lan yr argymhellion oddi wrth HDW. A hefyd beth sydd yn digwydd wedyn, ydy'r dystiolaeth sydd wedi cael ei asesu, ydy hynna ydy'r un peth yn digwydd yn y byd go iawn, pan bod yna filoedd neu ddegau o filoedd o bobl yn defnyddio y technolegau hyn. A wy'n credu bod cyfle arbennig i ni i gydweithio yn y dyfodol. Dyn ni ddim wedi gwneud hyn ar hyn o bryd, ond ges i wahoddiad i gynnig beth fedrwn ni'n gwneud yn y dyfodol yn y maes hyn ynglyn â offer a teclynefft y tebyg. Mae yna waith yn digwydd yn barod fel Scan for Safety neu'r MDIS Medical Device Standards newydd, lle mi fyddwn ni yn casglu lot mwy o ddata ynglyn â beth i ni'n defnyddio o ran medtech ar draws yr NHS, a mae'r cyfle i gyfuno hynna gyda rhaglenni sylweddol iawn a pwysig strategol fel y National Data Resource, fel bod ni'n cysylltu cofnod y claf gyda y technoleg sydd wedi cael ei ddefnyddio. Mae hwnna wy'n credu yn gyfle arbennig i ni ddatblygu'n partneriaeth mewn meysydd newydd gyda cyfuniad o ymchwil, ond hefyd profi'r argymhellion sydd wedi cael ei gwneud gan HCW. Ond dwi jyst eisiau dod nôl i be wedes i ar y dechrau, llongyfarchiadau mawr iawn ar y 5 mlynedd cyntaf, cyflawniad arbennig, dal ati a os allwn ni gyflawni gymaint gyda'n gilydd dros y 5 mlynedd nesaf a dros y 5 mlynedd sydd wedi bod. Wy'n credu bod hwnna yn mynd i fod yn rhywbeth cyffroes iawn i HCW ac i DHCW, Gofal Iechyd Digidol Cymru, ac i'r NHS a gwasanaethau gofal ar draws Cymru at ei gilydd. Na i stopio fyna a gwahodd unrhyw gwestiynau, achos wy'n gallu gweld bod Susan yn cadw pawb ar amser yn dda iawn.
Thanks, Ivan, very much indeed. Maybe I'll kick off with one question before we move on, and that is, why is robust evidence and clear guidance so important in relation to digital solutions?
Well, I think robust evidence is important. The guidance should be, in my view, this is a personal view, right? So this is not policy position by DHCW. Guidance should be embedded in digital systems. That is, they should have invested in user research and user design and the user interface. I wouldn't use the term Muppet proof, but to make it easier to get things right than to get things wrong. And there's a lot of research. There's Professor Harold Thimbleby in Swansea, for example, has done a lot of research on how poorly designed user interfaces can lead to unnecessary errors and sometimes harmful errors. So embedding the guidance into the interface, into the application, the service, is something that you can do with digital products in a way that you can't as easily with an inanimate medical technology device. You know, it doesn't correct you if you apply it in the wrong way, for example. I think evidence is really, really important, as robust as possible, because the digital marketplace just moves so quickly. There's too much of it. That is, you know, there are hundreds, thousands of health and well-being apps, especially in the prevention and the self-management space, that come out almost on a weekly and monthly basis. There's just too much, and there's always a lot of hype and a lot of promise from the manufacturers of these apps about how wonderful and transformational they will be for individual patients and for systems. And some of the evidence on things like how artificial intelligence was used as part of the COVID pandemic response is actually not that positive. There's very little evidence of where the tens, if not hundreds, of different AI technologies and algorithms that were offered and used in the COVID pandemic actually are strongly evidence-based in terms of retrospectively looking at the evidence of what in fact they achieved. So I think evidence is really important in digital, because people have a tendency to get very, very excited and think that because it's digital, it must be brilliant, like magic fairy dust. We can see that happening at the moment, you know, around waiting list initiatives and urgent emergency care in England, especially, where there's a lot of hype around how AI can be applied to that area. Now, hopefully, somewhere in the midst of that, there will be some things, but not all of the promise will be lived up to. So I think evidence is really important.
Thank you, Ivan. We love the opportunity to dispel the magic fairy dust wherever possible. So any digital topics, then please do bring them to us. So I think we're going to move on now. And I think Matthew is going to take over for a second.
Yep, thank you very much, Susan. Yeah, we didn't think it was fair for Susan to have to introduce herself, so I'm going to take over chairing just for a moment. That kind of gives the game away as to who the next speaker is, because it will be Susan Miles. And as I'm sure you're aware, Susan is the director of HCW. Susan has a background in health economics and has been active in the field of health technology assessment for around 25 years, I think I'm right in saying. And that's both at HDW and also in a previous role where she led the SHTG, the Scottish Health Technology Group. And Susan is now going to tell us more about the life cycle approach that we adopt at Health Technology Wales. So over to you, Susan.
Thank you, Matthew. Thanks so much. Katie, if you could have the next slide, please. So in my brief presentation this morning, I wanted to outline the life cycle approach that HCW has adopted in its health technology assessments and how specifically this supports innovation within Wales. Next slide, please. So there are probably, amid the core of the HT activity, there are 6 key life cycle activities within the phases, both pre and post, if you like, conventional HTA. And I'd like to just describe some of HCW's activities in each of those, please. Time doesn't permit much detail, but in the slides that we're going to send you after the event today, there are some additional slides with links to case studies, examples, etc. So next slide, please, Katie. So early HT activities that are undertaken by HCW include collaborating to develop a new GB-wide innovative devices access programme. And this aims to provide a supported research and access route for innovative technologies that meet critical system needs. And the idea here is to try to get them to users at the earliest yet safest opportunity. We also support a range of national innovation programmes. We typically assess the applications and the available evidence to inform decisions and offer support to the successful innovators. We also produce topic exploration reports that Peter mentioned earlier, and these are really rapid overlooks at the evidence to see if there's evidence to appraise or to highlight gaps for innovations with less mature evidence. And these are provided to topic referrers and published. And I think we've already got about 400 of these on our website. We convene a virtual front door signposting group that directs innovators to tailored support to progress their technology to the next stage. And this aims to prevent innovators in Wales from ping-ponging around the system, because that's a common complaint that we hear. And we signpost them to the right experts to help them at that particular time. And this might be experts on research or intellectual property, etc. And we also offer our own scientific advice service, and this aims to provide, importantly, affordable advice to investors, to innovators, to assist them to develop their value propositions and build an evidence-based case for adoption. Next slide, please, Katie. So in terms of horizon scanning, at the Wales level, we hold regular open and themed topic calls as well as engagement events. At the UK level, we have various collaboration agreements and share topic intelligence to avoid duplication. And we also review and regularly select topics from the NHS Innovation Service, where developers and innovators register their technologies for consideration. And at the international level, we keep a close eye on what other agencies are doing through some international databases. And we've recently just signed a collaboration arrangement with the Australian and Canadian HTA bodies. Next slide, please, Katie. Key activities in the scientific advice and early dialogue area include the IDAP pathway and the scientific advice or SAS service that I just mentioned. But I just wanted to say that for our SAS service, we use mainly the NICE Meta tool or MedTech early technical assessment tool. And this undertakes gap analysis of a value proposition, and we work closely with the innovator to give them that feedback on their particular solution. And we've also offered early dialogue with companies bringing forward digital AI solutions and also COVID-19 technology solutions during the pandemic. Next slide, please. As Gareth has mentioned, our national guidance has an adopt or justify status, and we monitor uptake through our annual adoption audit, which we co-designed with key stakeholders. To direct this, we develop individually tailored monitoring plans for each piece of guidance that we prepare. And this adoption audit is sponsored by the All Wales Medical Directors, and the results reported to Welsh Government, to the Chief Medical Officer, and also to the Minister. Next slide, please. We're also committed to regular reassessment of the technologies that we've appraised. So roughly every 3 years after our guidance is published, and where it's felt merited or evidence has developed such that it might be expected to materially alter our recommendations, we can reassess technologies. And we've developed a SOP to direct this, and we've undertaken our first couple in the last year or so. And this has been important because it has resulted in some shifts from not recommended to recommended, etc. So important, we think, to keep your eye on the evolving evidence as well. Next slide, please. So disinvestment is the life cycle activity where we've focused least attention to date, and this is still very much a work in progress. But around half of our guidance has concluded that there was insufficient evidence to support adoption, and these clear non-investment signals we think are just as important for the system to receive as the investment signals. However, we do very much intend in the near future to turn our attention to more explicitly considering technology optimisation and disinvestment in collaboration with the Welsh Value and Health Centre. Cracking the disinvestment nut would see HTW undertaking targeted HT activities across the complete technology life cycle from innovation to obsolescence. Next slide, please. So what are the opportunities of this approach? Well, promoting targeted evidence generation that is useful to contextualise the decision problem within Wales is very important, and that's helped us to considerably reduce uncertainty, particularly in our de novo economic analysis. And our stakeholder feedback indicates that this has promoted ongoing and transparent communications, as well as fostering both HTA and cross-sector dialogue, so for example with regulators and industry. Next slide, please. But also it comes with some challenges. Adopting this approach is undoubtedly more resource intensive, and it's unrealistic for us to look at the whole life cycle for every technology. So we really do have to engage in careful targeting in terms of where to best place our efforts to get the most value out of HTW resources. And finally, we find disinvestment probably to be the most challenging lifestyle activity, both methodologically and practically to date, with a real dearth of topics. So do bring them forward if you have them, and we're looking forward to collaborating with partners on that. Next slide, please. So for more information, please have a look at our annual report and also some of our strategic plan, etc. that's on our website. I think we sent them in the e-briefing if you'd like more detail. Next slide, please. So reflecting then, just to sum up, there's been much discussion in international health technology assessment communities about developing more agile life cycle approaches to technology appraisal. And it's typically suggested that a paradigm shift needs to happen, recalibrating the focus away from just straightforward technology assessment to much more active technology management across the complete technology life cycle. And development of collaborative processes for evidence production that encourage early and continuous cross-sector dialogue are important, with increased attention on the innovation and discard phases is advocated. Yet few countries or HTA bodies have managed to achieve this to date. So Health Technology Wales, as a completely new HTA body, had a unique opportunity to be aspirational here and to try to adopt a life cycle approach in our operating model. And our stakeholders tell us that this has been very useful, and it's certainly helped us to embed ourselves within the Welsh innovation ecosystem. Of course, HTW is still young in its development, but we do feel that we've established proof of concept and that the value and the support that can be provided by agencies like ourselves to support Welsh innovators through the technology life cycle approach. Thank you, and I'll take a couple of questions if we've got time. Okay, so we have a question in the chat regarding how do we ensure horizon scanning undertaken by us aligns with system and Welsh Government priorities. So obviously we have some systematic methods to horizon scan, but the important thing is when topics come to us, we have a robust topic selection and prioritisation mechanism. And within that system, we routinely ask for every topic that's brought to us, is there evidence to appraise it? What is the population here? What is the unmet need? Is this likely to result in a large change in terms of either being resource consuming or releasing? And how does this align specifically with Welsh Government priorities and indeed other priorities in other organisations? So those are robustly applied, these criteria, with a scoring mechanism, and then those technologies come to our assessment group and we invite the external expert who has referred the technology, and we have a really active discussion at the end of which we just really try hard to think, okay, does this technology offer value for the system, and does it merit the the targeting of HW resources on it to address the decision problem? So that's how we try to do it systematically. Okay, I'm not seeing any other questions. So sorry, here's somebody here. I'm interested in disinvestment. Is there any guidelines for technology disinvestment for Wales? And if there is any, how frequently the guidelines is updated? Okay, so in terms of disinvestment, this has been a challenge for us. As I mentioned, we haven't actually received any specific disinvestment requests, despite having asked, but we have had a number. In fact, roughly 50% of our technologies that we've appraised have either got insufficient evidence to adopt, or indeed we have had a couple of cases where the evidence simply does not support adoption, and we think that's important. But we would very much like to be able to get into that space of how do we divest from technologies that are of low value, that actually don't offer benefit compared to perhaps more advanced technologies that have come upstream. So that's a really important question, because resources are scarce, and obviously to be able to invest, at times you need to divest. So we really would welcome becoming more active in that space, and would love to get some disinvestment topics forwarded to us. I would say though that it tends to require a slightly more in-depth process in terms of examining disinvestment, because obviously it's much more difficult to extricate things from systems once they're embedded than it is to add new things. So that's definitely in our line of sights and something that we'll be looking at in the very near future. So Lisa has posted a question regarding procedures of limited value or in-use interventions not normally undertaken. And in fact, this is a potential source that we're considering for disinvestment topics. So each of the territorial health boards have an in-use list, these interventions not normally undertaken, and we are interested to try to understand what among those might present themselves as potential disinvestment opportunities, and how could we offer that guidance, because the value of HTW guidance is that it's given nationally to the system as a whole. And in the same way, we also support the individual patient funding request panels to try again to help with consistency in terms of decision making on whether to refer patients for particularly for certain treatments or not, where they're specific in some way or exceptional in some way. Okay, so I think probably we need to move on now. So thinking about our next session, we're going to have our final talk under the innovation theme is going to be provided by Tom James, and Tom is Head of Innovation and Technology at Welsh Government. He was talking a bit about the new Welsh Government's integrated innovation strategy and hopefully the contributions that HW can make. So Tom joined Welsh Government from Aneurin and Bevan, where he led on innovation in a secondment role. But prior to that, he had a 9-year career at Welsh Government, where he held several roles and led the Bevan Commission NHS Wales COVID-19 Innovation and Transformation Study. So over to you, Tom. Thank you.
That's great. Thank you very much, Susan, and thanks for what has been a very, very informative morning, actually. Like Ivan, very fortunate really to be involved in the HTW journey, not since day one, but certainly from an oversight role in Welsh Government for a good few years now, and really, really impressed with the really systematic evidence-based approach that HTW have taken to their work, and actually, we in developing the integrated innovation strategy for Wales, and indeed what we're now calling the health and well-being mission of that strategy, we relied on a significant amount of evidence, not just from the NHS, from social care, and from the public, but actually from HTW and organisations that we fund through our recently rebranded Innovation, Technology and Partnerships programme. And actually, so in developing that strategy, very, very important, to reflect on, to reflect on a significant amount of evidence that was generated, and evidence being a key theme that we've heard more and more and more today. So actually, not just evidence from organisations, but key stakeholders we interviewed 30, 40 key opinion leaders across the sector. We utilised the COVID-19 Innovation Transformation Study. We had specific evidence submissions from every NHS Wales organisation, as well as engaging very, very significantly with the public. Undertaking a number of different public consultation events, in the autumn. So fortunate to say now that the consultation for the integrated innovation strategy did close at the end of September, and we're now reflecting on all the additional evidence that we generated, and actually thinking about the final version of that strategy, which we're hoping to launch on St David's Day. next year, subject to a range of different political clearances, of course. But actually, if we look at the integrated innovation strategy specifically for health, there were a number of recurring themes. So coherency is probably the biggest theme that the evidence told us. So actually getting the NHS and social care system to understand what their needs are, what their priorities are, and how we use those needs as innovation pull. And how do we get the NHS and social care working, with what is a much more developed innovation ecosystem across health and care now, certainly than there was a decade ago when I first started working here. So how do we get that innovation ecosystem, the external ecosystem to health and care, to offer that innovation push, that system offer? So bringing together the innovation pull and the innovation push together in a much more systematic way. And where we do generate a range of different pipelines of innovation there, how do we get those pipelines of innovation adopted through a range of different mechanisms, of which we're exploring the new NHS Wales executive function as one of the key mechanisms to do that. We talked about aligning innovation to system priorities, but also how do we support innovation, not just from a leadership point of view? How do we get chief executives and executive directors to support the innovation agenda? But how do we create a culture of innovation at all levels of the system? How do we empower our practitioners, our managers, our staff to think differently about the ways in which we work? So that's going to be a key theme of the strategy, and we're going to be looking at specific interventions that we can take forward to build capacity at all levels of the system. So it's not just a top-down approach to stimulate and enable innovation. It's a culture that takes place at all levels of the system. So, but also we need to understand, whilst we have a huge amount of innovation interventions now, programs, organisations, platforms, events, we need to bring those and get those working together in a more coherent way, and we need to do that through some additional infrastructure for innovation, which learns the lessons from our research and development, from Health and Care Research Wales, which is which badges itself as the one-stop shop for research, for health and care research in Wales. Improvement Nghymru, value-based healthcare programme, healthcare sciences programme. We've got some really good examples across the system here where there is national infrastructure that supports a particular agenda, and we need more of that for innovation, certainly. So there's, I've heard, one front door is a difficult way to, is a phrase that people use, but actually for me it's the wrong term. It's no wrong door, I think, is probably the best way I'd like to describe it. And as I say, we'll continue to support the innovation agenda through our rebranded Innovation Technology and Partnerships programme. And actually, as we do see Health Technology Wales as one of our kind of flagship programmes as part of that programme. It's developed its scope and activity over a number of years now, over 5 years, but also what it has done, and I guess thinking about Health Technology's role in the integrated innovation strategy of Wales and how we take forward that integrated innovation strategy, we do see Health Technology Wales as one of the key developers of a pipeline of innovation, evidence-based innovation that we need to more systematically adopt across health and care. We need to understand how do we, and we need to drive Health Technology Wales topic calls to be linked to health and social care priorities. We also need to optimise that interface between NHS Wales, social care and Health Technology Wales, and we've done a piece of work through that recently where we took a paper to the NHS Wales Leadership Board, and we requested specific details from all NHS Wales organisations as to how they, what specific groups, what specific people, what specific networks and committees within their own organisation they were using to adopt and consider Health Technology Wales guidance. We know that Health Technology Wales has developed a strong, robust evidence assessment process. So how do we take that assessment process and apply it to the assessment of innovation more generally across the system? Evidence-based innovation is very difficult to argue with. So how do we take that knowledge, that capability that exists within HCW, and how do we apply it to other areas? I think is a really important point, especially given some of the system level level, the UK level interventions that have been established at the moment through such as the Innovative Devices Access Pathway and others. So we, just to kind of echo some of the slides that Susan put up recently, we do see Health Technology Wales having a role to play in horizon scanning for new technologies, but also new trends across our system. As our system develops, as our system changes, we've seen significant changes off the back of COVID-19, but also as new innovations are introduced and developed, not just from the private sector, but in conjunction with academia and clinicians as well. So we do see health technology having that role to play in helping us to see how the system is changing, how things are changing across the horizon in the future. I think that's me on time. I can't see any questions that have popped up there, but very happy to to take anything else offline if needed. But I'll leave it there for now, Susan. Thank you.
Thank you, Tom, and for sticking to time. We're a bit pushed, so I'll maybe just take one question. And I think we're really excited and looking forward to the launch of the new Integrated Innovation Strategy. And I guess my question would be, how will it be successful? How will you know it's been a success? What are the key things you really want to see from it?
Well, we see more and more, and we would like to badge ourselves as a value-based healthcare system in Wales. I think it's a very, very reasonable thing to say. So how do we develop, or not how, we have committed in the strategy to develop a measurement system for innovation that is based on value-based healthcare. Yeah. So what are the improvements made to patient outcomes? What are the improvements made to patient experience, and what are the improvements made to resource efficiency? You can't, because everything comes back to that, doesn't it, Susan? Every improvement that you make within the health and care system comes back to one of those three, or a combination of those three tenets of healthcare value. So we have to keep the measurement process simple. I think we can overcomplicate these things sometimes. So as part of our innovation action plan, which we're developing, which will sit alongside the strategy and be launched by the Minister following the launch of by the Minister for Health and Social Services, following the launch of the overall strategy, we will be launching an innovation action plan to take forward this work, and you'll see in there that we will commit to a value-based healthcare measurement process for it.
Thank you, Tom, and we very much look forward to playing our part. So that takes us into our final session for today, and we're going to move on now to consider a little bit about what the future holds for HTW. So HTW recently commissioned Mark Campbell to undertake an independent review of our work over the last 5 years, and he's going to present some of the headline findings from that review today. So Mark is an independent consultant in evidence-focused value demonstration of health technologies. From 2010 to 2019, he was responsible for the leadership and development of NICE's device diagnostics and digital evaluation programmes, so eminently qualified to tell us how we're doing. Thank you, Mark. Over to you.
Thanks very much, Susan, and thanks also for the chance to take part in this fantastic anniversary celebration, and also thank you to the HTW team for asking me to work with them and help reflect on the progress at this milestone. It's been a real privilege to work with you. This, I think, maybe at risk of feeling a little superfluous, because I'm sure people will have been able to judge for themselves the sort of breadth and depth of the activity presented just in this sort of short morning. But nevertheless, I was pleased to be asked to provide some external independent commentary on Health Technology Wales. Next slide, please, Katie. And so the next plan for the next 15 minutes is just to give you a flavour of that work, and particularly some of the key findings and sort of pointers for the future. Next slide, please, Katie. So the background to the review after 5 years was very much a follow-up to some work that the team commissioned again from me at their sort of 3-year birthday, the sort of methods were similar, and this slide really should have a spoiler alert, because you can see that the key findings at that stage were very positive, and you might think, well, it would have taken a sort of deliberate act of sabotage to arrive in a different place 2 years later. But nevertheless, those 2 years have been years of growth and development, and so the team was clearly keen to have another kind of fresh set of eyes perspective on their progress at 5 years. Next slide, please. And I show this slide not because we've got time to cover the detail, but really I think it really helpfully illustrates the commitment that the team showed in putting together a set of, really kind of comprehensive and searching questions. And, it's a really kind of healthy attribute to want to get, to invite external kind of independent scrutiny. Sometimes that can be a bit uncomfortable. You hope it's going to have a good outcome, but I think it's to the team's eternal credit that they wanted to kind of open themselves up in this way. Next slide, please. So this was a relatively rapid review over the last couple of months. Total sort of time commitment, just to give you a flavour, about 7.5 days, kind of, altogether of work. Similar methods to the review in 2020. So a combination of looking at the extensive documentary evidence, some of which you've seen referred to in earlier presentations. I think I managed to look at about 130 odd documents. Observing, really grateful to have the chance to observe those meetings held in public, the assessment group and appraisal panel to consider how the decision making is undertaken and the quality of the work. But really importantly, talking directly to both staff and external stakeholders, about 25 people in total, most of whom were external stakeholders across the Wales health and care system and in organisations outside Wales. And I guess it's a sort of special thanks to those people, many of whom are here or have spoken today, because that input's incredibly important in sort of trying to triangulate impressions that you get from documentation and sort of bring it to life, if you like. So that was how the work was done. Next slide, please. Key findings, I hope, from what you've seen today, and certainly in follow-up to the 3-year review, will be unsurprising. So I think HTW absolutely demonstrates its core functions. So those are the core functions set out in its establishment by Welsh Government to find promising stuff, to appraise it, and then that kind of final step, which is so often missed, to say, well, so what? What's happened as a result of us making these, very sort of deliberated recommendations. It's not an organisation that stands still. Certainly the last couple of years have seen growth, and I don't think it's too strong to say that its approach to that is bold and ambitious, but nevertheless it remains a high functioning unit. It's not, as I say, an organisation to stand still. So having commissioned the report at the 3-year stage, there's been a kind of very active attention and progress based on the improvement suggestions at that stage. I wanted to note kind of things that were particularly significant since the 2020 review. So you've heard a lot about the contribution to the COVID-19 response, and I think that the kind of track record of basically stopping everything else you're doing and focusing on that to produce a significant volume of high quality work, and then kind of returning to business as usual is a considerable achievement. I think, as has been mentioned, the careful approach to developing a strategic plan, really important, really strong foundation for future development. And the last two have been mentioned, so the adoption order and the work on social care. But I just wanted to kind of highlight these because from the perspective of kind of health technology assessment, HTA, which is HTW's core business, these are particularly challenging things, and I think that both are sort of not only nationally but internationally kind of innovative and noteworthy. Certainly, I don't, in my experience. So I've worked in the English NHS for almost 40 years before working freelance, and as Susan says, I spent 10 years at NICE as the last 10 years of that. I can't think of an example where the uptake of devices, diagnostics and procedures that are recommended by an HTA body has been tracked in such an effective way as in the adoption order. And I think the foundation the pilot has laid is a fantastic sort of platform for the planned annual updates. And similarly, the work on social care technologies is innovative. As others have noted, Lisa and Sarah, this is an area where, you know, even the language and the vocabulary are different. So I think I welcome seeing how the topics that are under appraisal surface, and hopefully they'll be as successful as the guidance on the START intervention. Next slide, please, Katie. Thank you. We've had a lot about impact today, and impact in the context of an HTA organisation, Health Technology Assessment. And I just wanted to reflect for a moment on the extent to which HTW can be judged on the impact of what it does, because it is a very peculiar perspective, this whole sector of health technologies. So if we think about its three core functions, going sort of left to right across the arrow at the top of the slide, so finding stuff that's worth evaluating, actually doing the appraisal, and then you know, that goes out into the wild. Only that middle section, the yellow bit on the slide, is actually under the direct control of HTW, and so that's a bit that it can absolutely make sure that it does really well. The early bit of finding the stuff is really messy. It takes a long time. You don't see a lot for your efforts. It's a bit like an iceberg. Most of the work goes on under the water, and you have to kiss a lot of frogs to find the prince, is often a phrase used to describe it. So I think, you know, it's worked hard to improve the efficiency of that, but it will eternally remain slow and messy, despite sort of best efforts. And then on the right hand side in the blue box, well, that's when the guidance gets let into the wild, not under its direct control, relies on a complex health and care ecosystem, sort of operating under severe pressure. So, you know, I just wanted, others have kind of reflected on that landscape, but I just wanted to, in the context of, you know, as an external reviewer, trying to judge the impact of HTW, that's a really important context, which is actually, it's only the yellow bit that you can kind of properly judge it on. Next slide, please, Katie. However, despite that rather gloomy picture, there is plenty to celebrate. So as the clock fell on the report, there were 29 pieces of guidance. That's out of date by a couple now, and the outcome is summarised here. And just over a half of those products, technologies, procedures were recommended for adoption, either kind of unconditionally or with sort of optimized recommendations, which is a great outcome actually. And those recommendations span a whole spectrum of technology types, devices, diagnostics, procedures, social care interventions. It's an incredible mix, reflecting the hard work by the team. And then just under half of those are for further research or not supported. And I think I was struck by something Susan said in the last presentation, in the sort of which is that's not a no. And actually, for technology developers or for those people who are enthusiastic about the adoption of those technologies that didn't get supported, you know, that is the absolute best free consultancy you'll ever get on where the evidence gaps are, that just sort of prevent those recommendations, those products being recommended. And it was good to see in among those recommended a couple of topics coming back for reappraisal, and that's typical of health technologies. So when you pick them up early in their market life, they've got evidence gaps that prevents you making a full set of recommendations, but 2 or 3 years down the line, you find the evidence base is matured and you're able to make a more complete set of recommendations. So it's good to see an active review program going on there. Next slide, please, Katie. Last couple of slides. Yeah, so the full report has, I think, about 17 or 18 suggestions for further improvement. But I just wanted to highlight 3 or 4 that had particularly strong support from external stakeholders. So the first of these, perhaps inevitably, because HTW is a small organisation by this, you know, within the context of the NHS in Wales. So further work needed as ever, and you'd expect this at the 5-year stage to consolidate its profile, but also to try and kind of just explain how its offering fits, you know, sits alongside that from NICE, remembering that NICE has been around for 20 years compared with HTW's 5. So how do we kind of co-explain that to give the, you know, the boost to the most number of recommended proven technologies? The second of these, consider a topic call based on system priorities. So that's about kind of how do you help the system recover from COVID. It's a little bit of be careful what you wish for. So we tend to think we have this sort of we have this notion that there are kind of blockbuster technologies that are really going to sort of disrupt care pathways. Actually, they're relatively few and far between. In many cases, you know, technologies are enablers. It's people and processes that affect the change, but nevertheless, it's not a reason not to look for them. And there were certainly elements of that in the region in HTW's recent digital topic call. There is more work to do, as the team acknowledges, on coordinating topics with other HT agencies. I think HTW's got a strong track record of this, and it's well placed for future collaborations. And then, as was mentioned in the previous presentation, opportunities arising from the Innovation Wales strategy. I think, you know, most of us here will recognise the innovation landscape as a really crowded place, so I think the team needs to target its efforts. It seems to me that working upstream, as it does in its scientific advice service, on early evidence generation and evidence design is kind of the sweet spot, and hopefully would result in more technologies coming forward with a mature evidence base which are able to be recommended when they're eventually appraised. So next slide, please, is the last slide. Couple of conclusions. I think that HTW is clearly, in feedback from stakeholders, recognised as the go-to place for clinical and cost effectiveness assessment, and I think in Wales, and I think its forward plan provides a really strong foundation. And I think the thing that struck me all the way through the review, both reviews, both at 3 and 5 years, is how close it is to its stakeholders and the added value that that brings compared with an organisation, the one I know best is NICE, operating in a much bigger country environment. So that closeness, I think, has the potential to, has already had, and the potential to bring further real benefits. Thanks very much.
Thank you so much, Mark. And can I just say it's been hugely helpful to us to be able to have your fresh eyes and extensive expertise to reflect from the outside in and to give us improvement suggestions so that we're always evolving and improving the HW offer. So thank you very much indeed for that. We've got one question that's come in that says, what excites you most about HW's work to date and in the future? Yeah, it's a good question. There are a couple of things. I think if I can be slightly kind of flippant, the organisation's enthusiasm is incredibly infectious. So traditionally, you know, health technology assessment people are a bit nerdy. They are by nature, you know, anxious perfectionists. But I think HTW's sort of pragmatic enthusiasm and ambition is kind of, if anything's a sort of predictor of success, I think that is. But I guess the serious answer, Susan, is that closeness to your stakeholders gives you, I think, the potential to address their kind of technology challenges in a way that a bigger organisation operating in a bigger country like NICE in England is not able to do. So I think, you know, that link has been evident in several topics that I came across in the review. So I think the track record of collaboration and the ability to be responsive to people that you're really close to, I think is exciting. Thank you, Mark. And I have to say, I'm quite happy to be classified as an anxious perfectionist. I think it sums me up rather well. I can't speak from other colleagues, but I'll take that any day of the week. Really okay, good. Thank you so much. We're going to move on to just the final couple of presentations before we wrap up and conclude today. So Matthew, who you heard from earlier, is going to talk a little bit now about our key priorities going forward for the coming year, and also importantly, to explain our process for referring a topic. If you'd like to discuss a potential topic, then please do stay on the line after the event concludes, and the HW team will be available to discuss that with you and to take you through that process to make it as easy as possible. So over to you, please, Matthew. Thanks.
Thank you very much, Susan. Yeah, nice to not be called a nerd for once. So one of the cool Health Technology Wales people will be giving you this presentation. Yeah, so we're going to talk a little bit about Health Technology Wales's future priorities and the topic referral process, largely as a means of trying to encourage you to think about submitting us some topics to us. So yeah, next slide, please, Katie. So I think, as Mark actually mentioned in his presentation, one of the things that we've done since 2020 is publish our strategic plan, which we published in 2021, I think. And that kind of outlined our 4 main areas for strategic goals, our 4 pillars, as we sometimes refer to them, which is identification, appraisal, and adoption of health technologies, and a wider kind of goal around engaging with the community of stakeholders that are engaged in health and social care decision making. So yeah, I won't go into all of the nitty-gritty details of all of those, but yeah, those are our 4 key areas. And I was just on the next slide just going to speak about one of our key objectives, which is really to expand our appraisal and guidance output, and not only to think about expanding the quantity of that, but also to think about actually ensuring that the quality in terms of actually hitting those high priority topic areas that we think would be of most interest to the people, the core audience of the people that we're producing the guidance for ultimately, and ultimately that's the people of Wales, and ensuring that the areas we're focusing on are those areas that have the potential to have a big impact for care services, both health and social care, for the people of Wales. And the costs and system aspects of all of that as well, obviously a big factor. So we're thinking, in future, certainly I've listed some there that come up quite frequently as areas of current concern, and social care, mental health and COVID-19 recovery, as well as digital technologies. And there's probably some more that we could throw in there as well around diagnostics and cancer care. So those are, I suppose, our intention really is to ensure that our model is that we take what people submit to us, and we're somewhat beholden to what we receive. And what our key aim is really to ensure that what we're receiving is those things that are going to address the major needs of the service. As I've said, they're answering the questions that really matter to services. Next slide, please, Katie. One of the ways that we do that is that we run open topic calls. That certainly this year we've run with a specific theme in mind. So two of the areas that I mentioned in the previous slide, the social care and digital technologies, we ran open topic calls on these areas this year in 2022. So really this is kind of a promotional push. We're asking people for a period of time to really think about challenges within those specific domains and to send us topics on those aspects that we'll then consider for an appraisal. And yeah, it's something that I think we'll probably do next year as well, with future open topic calls on other priority topics. But I would also just stress that these topic calls, they're a promotional push. They're getting people to think about those specific areas, but it's also worth remembering that you can submit a topic to us at any point in time, and we will consider it. So the door is always open in that respect to receive topics. Next slide, please, Katie. Yeah, and our topic submission process is relatively straightforward. If you want to submit a topic to us, there's a section on our website that has a form for you to fill in. Relatively straightforward form. You don't have to write an essay in response to the questions that it asks. There's around 15 questions, covering things like the broad area, disease area, if it's clinically focused, the technology, a brief description of that, a brief description of how it would fit into the current care pathway and what it might displace it or be in addition to in the care pathway, and if you know of any existing evidence. But like I say, you don't have to write an essay to those sort of questions. It's a relatively straightforward thing that's really designed to signpost to us the useful aspects, the bits of information that you do know that we can then pick up and actually have a look at things in more detail and determine really whether it's suitable for us to consider for a full appraisal. And if it's not suitable for a full appraisal, there may be other ways that we can help you through our signposting group. We may be able to send it on to someone else who might be able to help if it's more a question of needing further evidence generation or something along those lines. Then that's something that we may be able to help with through that signposting group. Next slide, please, Katie. And yeah, just as a reminder, just of the breadth, I suppose, of HTW's remit, is worth thinking about, because I think sometimes people hear the phrase health technology and they think fancy digital type technologies. It doesn't necessarily have to be that. The remit is actually very broad. It is any non-medicine technology, so that includes all sorts of things: psychological therapies, follow-up processes, devices, diagnostics, and also worth bearing in mind that the remit is broader than just health as well. It's also covering social care, and so there could be some technologies around there that could be of interest to us too. Next slide, please, Katie. Oh, and that's it. Thank you very much. Yeah, so I suppose on that last point, just a final again to implore you today, if you do have any kind of burning issues that you think we could help with and help you address, then please do submit a topic to us and we'll give it due consideration. Thank you, Susan.
Great, thank you, Matthew. So maybe I could just pose one question if there are no others coming into the chat, and that is to say, I wonder if you could just say a little bit more about how we're working with NICE to try to avoid duplication in terms of our work programmes and remits.
Yeah, it's a good question. So we do, and again, Mark touched on this a little bit too, but we try to avoid that duplication of effort. I suppose it's research waste for a start to have two sets of researchers looking at exactly the same thing, and also maybe a little bit confusing for people on the ground to have to deal with making those decisions if you've got advice coming from two different places. So where possible, we always try not to duplicate guidance and the efforts of NICE. And we do that, I suppose we have regular contact with people at NICE. We have our memorandum of understanding, and we have regular catch-up meetings with NICE. We try to share our work plans and our work programs to have an idea of what they're looking at, so that we don't consider the same thing, and vice versa for them as well. Yeah, so I suppose we make our best efforts to ensure that we don't duplicate their work. It does still happen from time to time, because I suppose they're looking ultimately like us, trying to hit the areas that are of most interest, and sometimes that means that you end up looking at the same thing, but we do our best to avoid it by regular communication with NICE.
Thank you, Matthew. I think we'll draw stumps there. And just to say, do remember you can stay on Teams if you'd like to speak with any of the HW team after today's events. Just before we move into closing remarks, we'd really value your feedback on the session today, and we'd be grateful if you could take a couple of minutes to give us some feedback on the questionnaire that I think Diana's just posted in the box. And thank you in advance for taking a couple of minutes to offer feedback and help us to think about and plan future events. Okay, so now I'd like to invite Professor Peter Groves as the HW Chair to offer some closing remarks before MD who wishes to stays on for the optional topic referral session. Thank you. Over to you, Peter. Thanks.
Susan, thank you so much, and thank you everybody for attending again what has been a really interesting and stimulating morning. You've received an awful lot of information from us this morning. Hope it hasn't been too overwhelming. But certainly we hope that it has been interesting to you and relevant to your professional lives and the environments in which you work. And we hope that you'll take messages away to be able to strongly collaborate with us in our work together. I hope also we've convinced you that we are an organisation that is delivering on impact, that we offer value to the health and social care system in Wales, and that we are genuinely offering support to the innovation that is going on within the system. We hope that we've convinced you that we are a mature health technology assessment organisation that is high functioning, that we're delivering on our remits and our roles, and that we are an organisation that can support your aspirations. I don't want to summarise or talk about a lot of what we've heard, but I do want to just reiterate one or two important points from the perspective of the future direction of our organisation. As has been picked up by some of the speakers already, we're a very positive organisation. We are very optimistic about the future. We have a very clear idea about our future direction, which is outlined in our strategic plan. But like all organisations, especially those working within the health technology assessment environment, there are challenges and there are hurdles that we need to overcome, and we need to be careful that we're doing everything we can within our organisation to overcome those. And I think Mark Campbell's comments were very pertinent, particularly around the impact factors and factors that any HTA organisation, not just Health Technology Wales, but also our partner organisations, NICE, Scottish Health Technology Group and others encounter. We can do all we can within our organisation to provide high quality services and health technology assessments, but the elements before and after remain a challenge. I think perhaps the biggest challenge for us in the future is what comes before Health Technology Wales. In other words, the identification, the notification of topics that are going to be of not just volume, but also the greatest value to the work that we do. We do have the ways in which we overcome that internally. So you've heard about horizon scanning, you've heard about the responsiveness of our organisation to notifications when they come in. You've heard about the collaboration that we have with the Innovation Service sponsored by NHS England. But we have this contact, and I think Mark drew this point out very well, because of the size of the populations that we serve and the number of organisations that deliver care within Wales, we have this opportunity, this contact of direct relationships with care providers that I think we really need to leverage as best we can in the months and years ahead to ensure that the work that we're doing continues to be as impactful and of greatest value as possible. We're looking to work in partnership with LHB's specialist health boards, commissioners, to ensure that we have a methodical approach to that it isn't random, but that actually we have regular points of contact to ensure that they feel a responsibility to notify topics to us. I know as a clinician working at the coalface that it is the people that are providing the services within the care environments that actually know the topics, the technologies that are going to have the greatest impact in improving the service they offer. So I want to finish with a challenge and an appeal to all of you, our stakeholders, our friends, our partners within the system. Please think away, go and talk to your colleagues and people that you work with about the ways in which we may be able to support your aspirations. If you're an innovator, if you're a developer, please think about liaising with our scientific advice service and think about how we can share our expertise with you to be able to think around a strategy for evidence gathering that will support your value proposition. But if you are somebody who works in a care environment, whether it's healthcare or social care, please think about technology-orientated solutions, ways in which you can improve the value of your service, and particularly those where there is a mature evidence base. Think about coming to us. As you've heard from other colleagues, please do notify us of technologies that you think would benefit from our appraisal and our work. So just to finish, I'd like to thank a few people. All of the Health Technology Wales members of the team have been involved in both the preparation and in the delivery of this meeting this morning. So my thanks to them, but specific thanks firstly to Susan Miles for chairing the morning's meeting so well. Thank you also to Lisa King. Lisa has led the planning and delivery of this meeting. Thank you also to Katie McDermott and to Rebecca Shepherd, who've overseen things and made sure things have run so smoothly this morning. Thank you to everybody. Thank you to the presenters. We've heard a lot from experts. Thank you for your expertise, for the time that you've put into planning and delivering your talks to us this morning. Thank you for keeping to time so that we've been able to run the meeting smoothly. And thank you also for the continued support that you give to Health Technology Wales, which is of course invaluable. And thank you to everybody who's attended. Thank you for your interest in our organisation. And we hope that you've sparked further interests in becoming more involved with us. As Susan has said, if you'd like to talk to us specifically about any aspect of our work, topic notification, but other aspects too, feel free to stay on the line after the meeting. But let me draw to the meeting to a close now, just by wishing everybody well for the festive season ahead. I hope you've enjoyed this morning's meeting, and I wish you well, stay well, and Jock, thank you very much indeed. Thank you.
Thank you, everyone.